You're right, Jim.
Diane,
Yes, Jim.
I'm retiring on September 1st from the airlines.
You are. After how many years?
33 years and 10 months.
Wow.
I'm leaving a little early. But not really early.
Well, getting out while the getting's good.
Well, you get out of the place
For sure.
So, Andrew, are you ready to go?
Mr. Chairman, we are ready when you are.
Okay. Okay, we'll call this October 4th meeting of the Board of Supervisors back to order. We have two remaining items to deal with on today's agenda. First one that we're going to deal with is item number 2, receiving an update on the COVID-19 response. Ratify actions, receive update on the costs associated with engaging a third-party statistician, and authorize any other action necessary to address the COVID-19 pandemic. I know that we do have a staff presentation, and just for planning purposes, Mr. Potter, how many speakers do we have? I understand we have one group presentation, which will allow 10 minutes too, and then how many individual speakers?
Mr. Chairman, we have 53 speakers on this item.
Okay, let me turn it over to staff then to go ahead and do the presentation.
Mr. Chairman, before we begin the staff presentation, for those members of the public that have requested to speak on this item, please dial into the conference line now using the instructions provided to you. You will be muted until it is your turn to speak. Thank you.
Good afternoon, Chairman Cox and members of the board. It's been a month since we last provided an update to your board, and there have been several new developments in COVID-19 response. We remain on the state's watch list for having elevated case counts for 5 weeks now, and we continue to see the number of community outbreaks increase. Because of this, we have recently established the Safe Reopening Compliance Team to support in addressing the needs of local businesses and other entities to ensure they are in compliance with the state and county regulations and are able to encourage the health and safety of their employees, customers, and communities. We also have requests for proposals, or RFPs, out to gather local interest from community organizations to provide community health worker outreach services and targeted communication to diverse communities within the region regarding COVID-19 testing, tracing, and treatment processes. To achieve the greatest coverage and the opportunity for rapid response, these RFPs have been divided into 2 phases. The first RFP closes today, so we'll be working toward identifying and working with these community partners in the coming weeks. A second RFP will be opened on August 18th for a follow-on contract. Today's presentation will feature our Public Health Officer, Dr. Wilma Wooten, who will provide a public health update and will discuss our local county triggers and our status on the state monitoring metrics. We'll also be joined by Andy Pease, our Incident Command Finance Chief, to provide an update on the CARES Act framework. Later today, in a separate presentation, Andy will also be discussing the allocation of $48.8 million in CARES Act funding as directed by your board at the July 7th board meeting. And we'll also be joined by Vince Nicoletti, Deputy Director of Planning and Development Services, who will provide an overview on the actions and the goals of the new Safe Reopening Compliance Team. Without further ado, I'll welcome Dr. Wooten.
Thank you, Don. Good morning, Chairman Cox and members of the board. The number of COVID-19 cases continues to increase, but numbers appear to be slowing down during the past week. Since the last presentation to your board, an additional 13,226 cases have been reported for a total of 30,226 positive COVID-19 cases through Monday, August 2nd, or yesterday. This table provides a summary of these cases with a breakdown by age, hospitalization, intensive care unit or ICU admissions, and deaths. 17,797, or 58.9% of the cases, are between the ages of 20 and 49 years of age. 2,599, or 8.6%, of all cases have been hospitalized, which has decreased from 11.2% since the last board presentation. 656, or 2.2% of the total number of cases, are in the ICU, and unfortunately, 565, or 1.9% of the total number of cases, have died. Of these cases that have died, 95% of these cases have underlying medical conditions. In the next slide, this table highlights cases by race and ethnicity. Among all laboratory-confirmed cases, 61.5% of the cases are among Hispanic and Latinx population. This is followed by whites representing 25.3% and Asians at 5.9% of the cases. However, when looking at the rates per 100,000 population, Native Hawaiians or Pacific Islanders have the largest rate of COVID-19 at 1,381.1 per 100,000 population, and Hispanics have the second highest rate at 1,364.4 per 100,000 population. Blacks or African Americans have the third highest rate at 673.8 per 100,000 population, and the rate among American Indians and Alaskan Natives is 468.5 per 100,000 population. The rate among whites is 405.8, and the rate among Asians is 333.9 per 100,000 population. The next slide is our classic epi curve, which shows cases by onset of illness. In recent weeks, starting in the middle of June, we show an increase in the number of cases, and then in the middle of July, with restrictions imposed by the state, we began to see the numbers decrease. And given the 14-day incubation period, we expect additional cases to occur for dates that are under the bar. As you know, the county has identified and continues to monitor 13 triggers for modifying the health officer's order. The 13 triggers are stratified across 3 categories, including epidemiology or surveillance, healthcare or hospital capacity, and public health or response. This slide shows a snapshot of the county's performance pertaining to these 13 criteria and triggers. A green check mark means that we have not reached the trigger measurement and remain in good standing. A red mark or X means that the trigger has been met and actions need to be taken. 10 of the 13 triggers are currently green, and 3 of the 13 triggers are red. In the following slides, I will review the 3 county triggers that have been reached, including case rate, community outbreaks, and case investigations. The first criteria is case rate. Trigger number 1 is met when the rate is greater than 100 per 100,000 population for a 14-day period with a 3-day lag. This is also the state metric that has placed San Diego County on the state's county monitoring list as of July 3rd. The case rate metric is used to assess the level of COVID-19 burden in any given county. This metric is calculated by the total number of cases diagnosed and reported over a 14-day period, divided by the number of people living in the county, which for San Diego is 3,370,000, and this number is then multiplied by 100,000. As of August 3rd, the case rate for San Diego County is 118.2 per 100,000. This metric has been elevated since June 30th and has recently been decreasing since July 29th. As a reminder, to come off the state's county monitoring list, San Diego would have to report 240 or less cases daily for a 14-day period with that 3-day lag. In this next slide, we illustrate a snapshot in time where we analyze the drivers of the increased COVID-19 cases. Over a 14-day period from July 20th through August 2nd, there were 6,091 positive COVID-19 cases reported for San Diego County residents. Of these cases, 2,574, or 42.3%, were in the 20 to 39 age group. This younger population tends to gather in public without wearing face coverings and practicing social distancing. The next, another group of cases were represented by food service employees, 257 cases of 4.2%, and community setting outbreaks during this period. There were 49 outbreaks representing 158 cases. And for the same 14-day period, 28% of cases reported resided in the South region and 20.1% reported resided living or resided in the Central region of the county. So trigger number 2 is related to community outbreaks. This trigger is met when there are 7 or more new outbreaks in community settings in a 7-day period. For the 7-day period from July 7 to August 2nd, there have been 39 new outbreaks again in community settings, with 19 or 49% in restaurants and restaurants/bars. This next slide shows community outbreaks by settings over the past 7 days. During the past 7 days, again, 39 community setting outbreaks have been confirmed, which represent 160 cases. The majority of these outbreaks, which is 19 of 39 or 49%, are in restaurants, 4, or restaurants/bars, 15. 4 new community outbreaks were added yesterday, including 2 in business settings, 1 in a government setting, and 1 in a higher education setting. In the next slide, to provide additional context, COVID-19 outbreaks in community settings continue to occur throughout the region. These outbreaks have almost tripled from 34 outbreaks in June, representing 211 cases, to 94 outbreaks in July, representing 499 cases. Since March 25th, 159 community setting outbreaks representing 1,152 cases have been confirmed. Overall, since the beginning of the pandemic, 293 total outbreaks have occurred in 3 primary categories, and I've already reviewed the third, which is community settings. We also have outbreaks in skilled nursing facilities and other congregate settings. Of the 293 outbreaks, 163 or 56% are now closed and classified as inactive outbreaks, meaning no new cases have occurred in the past 14 days. This leaves 130 or 44% of the 293 outbreaks that are currently active outbreaks. Of these, 26 or 30% of the 130 active outbreaks are in San Diego County's skilled nursing facilities, and there are 86 skilled nursing facilities in the County of San Diego. In total, there have been 721 residents and 464 staff with the laboratory confirmed COVID-19, including 143 deaths. There have been 37 or 28% of outbreaks in non-skilled nursing facilities or other congregate settings. In this category, there have been 680 residents and 477 staff reported, which includes 91 deaths. And lastly, we've already shared information about community setting locations, but of the 130 active outbreaks, 67 currently reside in community setting locations. And again, since March, we have had 1,152 laboratory confirmed cases, which includes 10 deaths. The third and final abnormal trigger is trigger number 11, which relates to the criteria of case investigations. This metric triggers when less than 70% of case investigations are initiated within 24 hours of notification to a case investigator over a 7-day period. For the 7-day period from July 26th through August 1st, 48% of new positive case investigations were initiated within 24 hours. In the most recent single day of work activities, 79% of reported cases received on August 1st had investigations initiated within 24 hours. As of yesterday, I am happy to report that the epidemiology program has caught up with all of the case assignments to case investigators, and 316 case investigators are working in this role. As your board is aware, the state of California ordered the closure of all indoor operations for the businesses that are identified at the top of this slide on July 13th. For counties on the state's county monitoring list, like San Diego County, businesses at the bottom of the slide were ordered by the state to close indoor operations as well on July 13th. In San Diego County, we continue to follow the guidance from the governor's office and the state health department. With the exception of schools, all indoor operations listed on this slide are closed indefinitely until approval to reopen is given by the state. Specific to schools, counties must be off the state monitoring list for 14 days in order to reopen schools. The exception to this is a waiver for elementary schools, and this includes preschool to or through the 6th grade. This guidance provides instructions for local health departments to provide to elementary schools to grant them a waiver in order for these schools only to open for in-person instructions under specified conditions. And we received the guidance from the state for this waiver as of yesterday. Applicants must satisfy all waiver requirements in order to be granted a waiver, and we will be disseminating this information to all of the elementary schools this week and anticipate numerous applications. In closing, while the San Diego County trend of case rates is showing a decline, continuing to see a decrease in cases from where we were a month ago is still very important. This is why we must continue to place or practice good hand hygiene and sanitation, maintain 6 feet from those outside of our household, wear facial coverings, avoid crowded places and gatherings, and stay home if you are sick. This virus that causes COVID-19 is still in our community, and we must continue to be vigilant in practicing these non-pharmaceutical interventions that we know work. Now, please welcome Andy Pease, Incident Command Finance Chief.
Thank you, Dr. Wooten. Good afternoon, Chairman Cox and members of the board. Today, I'll provide you a brief update on our spending tied to the CARES Act funds for fiscal year 1920, as well as what we are estimating through December, when the availability of the CARES funding is scheduled to end. As a reminder, the County of San Diego has been allocated $387.8 million of CARES Act Coronavirus Relief Fund revenue to address this emergency. $334.1 million was allocated directly by the federal government, and recently an additional $53.7 million was issued through the state. To date, your board has allocated $339 million of these funds, which you see in this chart under the planned amount column. Now, board agenda item 3 addresses the remaining $48.8 million of CARES Act funds that has yet to be allocated, and I'll be speaking to that later today. At this time, I'll be focusing solely on the use of the $339 million. Since the last financial update on July 7th, we have closed out our year-end financial books for 1920. Overall, we have used $124.6 million of the $339 million, 339 million through 1920, as shown under the column total 1920. The 124 million is a combination of direct cost and year-end obligations we incurred for each of these components, with the largest amount of use in the county response efforts. Through 1920, we have used 84.7 million of CARES Act funding, and by the end of December, we are projecting to spend a total of 166 million for county response, leaving approximately 9 million unspent of the original 175 million allocated. Now, as a reminder, these are for costs for things such as PPE inventory, medical equipment, public health staffing, medical staffing, staffing in all the groups throughout the county dedicated to the COVID-19 response. It includes sanitation, service and supplies, hand washing stations, portable restrooms, communication, outreach efforts, teleworking costs, administrative costs, and so forth. For the rest of the areas, from T3 to Child Welfare Services outreach, we anticipate that all of these allocations will be spent by the end of December. So out of the 339 million allocated, at this time we estimate we'll spend a little under 330 million of it, with 9 million remaining. I'll note that these December 2020 estimates are fluid and they are dependent on many variables, not the least is the length and trajectory of the COVID virus, when a vaccine or treatment may be available, the level of need and availability in the acquisition of PPEs and other equipment. The estimates do not include costs beyond December, when the CARES Act funding is set to expire. We'll be monitoring and reporting back the costs to this board regularly. With these funds being available for such a short period, we want to ensure we maximize their use. If we see we have more available in any area, we'll return to your board to consider reallocation of the use of these funds. For instance, in a minute, you'll be hearing from Vince Nicoletti with Planning and Development Services, who will be addressing safe reopening team compliance. A portion of this 9.2 million in CARES Act could be used for such efforts. Finally, recommendation 3 in today's item is for an update on the cost associated with engaging a third-party statistician to aggregate COVID-19 data and to come up with a high-level analysis. In looking at similar type of contracted services as well as reaching out to a local university, it is estimated to be a cost of about $33,000 for a statistical analysis of COVID data. That would include a high-level review and analysis taking into consideration epidemiological and health metrics, and a deliverable would include a comprehensive report, including a presentation to this board. However, subsequent to that board hearing, the maker of the motion has indicated that rather than a review of the epidemiological data, it would be of greater interest and value for a look at the economic and overall health condition of our region, including a look at unemployment, impact to schools, impact on mental health, and other pertinent areas. So at this time, we are not recommending moving forward with a third-party statistician, and if interested, we can arrange for experts in these various fields to present on the region's overall health at a future board hearing. That concludes my update, and now I'll turn it over to Vince.
Thank you and good afternoon. Pursuant to California Health and Safety Code Section 120175.5, all governmental entities in the county are required to take the necessary measures to ensure compliance with the public health order. While compliance efforts have begun, we believe it's critical to expand our enforcement role. As a result, we've established the county's Safe Reopening Compliance Team. We're presently hiring additional employees to help with expanding this team and our enforcement role. While our goal is voluntary compliance, escalated enforcement is also part of the process. Today, we'll highlight actions to date, discuss next steps in Phase 1 of the Safe Reopening Compliance Team, and provide options for the board's consideration to implement a Phase 2 of the Safe Reopening Compliance Team. In discussing compliance with the health order, there are generally 3 types of cases for which we are involved: egregious, outbreaks, and complaints. Egregious cases are instances of willful or sustained violation of the public health order that pose a significant risk to the spread of the virus. Examples include a gym operating indoors or a large indoor assembly such as a church. Outbreaks include both community outbreaks and pre-outbreaks. Community outbreaks are locations where there have been 3 or more confirmed cases by unrelated individuals. Pre-outbreaks are locations where public health epidemiology assessments result in the need for inspections prior to a community outbreak. There are 3 tiers to complaints. Tier 1 is a business or entity that is prohibited from operating under the health order. An example would be a complaint about a salon operating indoors. Tier 2 is a business or entity that isn't fully complying with their safe reopening plan. This can include not all employees properly wearing masks or social distancing with customers. Tier 3 would be staff using complaint trends to initiate proactive inspections. An example would be doing proactive inspections for a specific business sector or of concern or regionally. Compliance and enforcement can be customized for each case. However, the process typically starts with a phone call to the business or entity in question. If a complaint is received, staff let the business know about the concern that was raised and ask about their operation. If they are not in compliance with the health order or their safe reopening plan, staff work to educate and seek voluntary compliance. If staff don't feel compliance was achieved as a result of the call, we conduct a site visit to observe conditions and document our findings. Staff again seek to educate and achieve voluntary compliance, but also discuss the enforcement process if voluntary compliance is not achieved. When it's determined that a violation exists and the business or entity is not in compliance, the public health officer may issue a cease and desist order. It's important to note that any time a violation of the state order is verified, a local law enforcement entity may issue a misdemeanor citation which could result in a fine or imprisonment. This is also referenced in the cease and desist letters, as citations may occur after the order is issued. In instances of egregious cases or outbreaks, it's possible to move more quickly to a cease and desist order when the violation is verified. For cases within a city, there is coordination with the respective city contacts. To share some of our actions to date, over the past months, we've had departments that routinely inspect businesses for land use programs practicing see something, say something. When they're on routine inspections and see businesses that are not complying with their safe reopening plan, they've been elevating the issue to management at the business on the spot. Additionally, the Department of Environmental Health has conducted over 7,500 compliance checks of food facilities. Going forward, we'll continue to practice see something, say something. We've also been coordinating with cities and other jurisdictions when specific or egregious cases arise. Going forward, we're forming a more structured team with the compliance representative from each city and the county to coordinate. We're presently working with the cities to discuss roles and responsibilities. For example, some cities have indicated that they wish to take the lead on responding to concerns, engaging businesses within their jurisdiction, and elevating to the county only when enforcement is needed. Other cities have indicated they'd like the county to take more of a lead role due to limited resources. Cities are an important partner in that most businesses that seek flexibility in using outdoor space need to comply with the unique local land use and zoning requirements that each city has established. In terms of how concerns from the public have been reported, presently many have gone to 211, which then directs the public to the respective law enforcement department. Recognizing law enforcement may have challenges responding to these complaints while they focus on other elements core to their mission, we've stood up a dedicated Healthy Compliance call center that is a regional tool for the public to submit complaints for the cities as well as unincorporated communities. We've deployed an email for referrals to be submitted. We're also developing a mobile inspection application to make inspections more efficient. In terms of the complaint volume, from a regional perspective, there were over 4,000 complaints that went to 211 in the month of July alone. This includes all jurisdictions in the region. The Sheriff's Department has received roughly 4,200 complaints since March 19th regarding compliance with the health order, including complaints on masks, group assembly, among others. This represents only those communities that the Sheriff's Department has jurisdiction. Since March 19th, the Sheriff's Department has issued 144 citations. To date, the county has had the equivalent of 2 full-time staff outside of the Sheriff's Department following up on egregious cases that have come to our attention. This usually involves working with the respective city. Going forward, we're hiring additional staff to address more of the egregious cases, taking escalated enforcement when necessary. In terms of outbreaks, DEH has had roughly 8 staff conducting follow-up inspections for community outbreaks at food facilities, as well as inspections for pre-outbreaks for food facilities. Going forward, we're adding additional staff to conduct follow-up inspections for all official outbreaks, including the non-food facilities. We're also adding resources to conduct inspections for pre-outbreaks. This includes pre-outbreak epidemiology assessments and follow-up inspections when our EPI team identifies a need. We're presenting 3 options to the board for consideration as it relates to complaints. The first option would be responding to Tier 1 complaints, those for businesses or entities operating that are prohibited from doing so under the health order. An example would be an indoor gym, indoor salon, or assembly. The second option would be responding to Tier 2 complaints, those for businesses or entities not fully complying with their safe reopening plan. An example would be a business that doesn't have staff or customers consistently wearing face masks as they should. The third option would be implementing Tier 3, which is conducting proactive inspections based on complaint trends. This cost breakdown assumes the county takes the lead for unincorporated communities as well as cities, including initial inspections and engagement with the business or entity all the way through enforcement action. We're currently discussing roles and responsibilities with the cities. Depending on the number of cities that wish to take the lead for their initial inspections, these costs could go down. The following costs are for 6 months of operation. To comply with the Health and Safety Code, staff is already moving forward with Phase 1 of the Safe Reopening Compliance Team. This includes adding staff for the additional egregious cases, outbreaks, call center, mobile inspection app. The cost will be $1.4 million for 13 staff. This is in addition to the 10 staff we presently have working on egregious cases and outbreaks. No action is required by the board to move forward with Phase 1. Phase 2 could include addressing each of the complaint tiers as follows and is presented for board consideration. To address Tier 1, businesses or entities operating that are prohibited under the health order would cost $1.8 million and require 22 staff. To address Tier 2, businesses or entities not fully complying with their safe reopening plan would cost $2 million and require 24.5 staff. To address Tier 3, conducting proactive inspections would be scalable. For example, the cost of one staff member conducting roughly 120 proactive inspections a month would be $120,000 for the 6 months. This includes follow-up actions for any violations observed during those inspections. Implementation of Phase 1 for the Safe Reopening Compliance Team has already begun. The Healthy Compliance Call Center went live today. We are already expanding the number of egregious cases we are addressing and will continue to make them a priority as we onboard additional staff. This week, we begin conducting outbreak inspections not already inspected by DEH, and will begin pre-outbreak inspections the week of August 10th. Staff requests board direction on the options to respond to complaints under Tiers 1, 2, and 3. I'll now hand it back over to Don Stoyer.
Thanks, Vince. In addition to receiving this update, we recommend your board take the following actions with respect to this item. Ratify all actions previously taken in response to this local health emergency and local emergency. Receive an update on the costs associated with engaging a third-party statistician, and take all other action necessary to address the COVID-19 pandemic emergency response. Subject to your questions, this concludes our presentation.
Very good. Thank you for the presentation. Are there any questions of staff before we go to the public communication speakers?
Mr. Chair.
Yes, Vice Chair Desmond.
Thank you. So I had a couple questions for Wilma, and then or Dr. Wooten, and then one on the compliance. Dr. Wooten, you mentioned that we had to get to less than 240 cases per day. Is that for the case rate, or did I mishear that number?
Thank you for that question, Supervisor Desmond. You are absolutely correct. That is for the case rate. So in order for us to be below 100 cases per 100,000 population, we would have to report 240 or less cases daily for 14 days.
I guess maybe I'm doing my math wrong, but 3.3 million, that would be, I thought it'd be 330 instead of 240, but I can check my math later.
We can have
the other
provide the math. Our senior epidemiologist who works on all of our data provided that information, and we can provide that to you. Keep in mind the case rate is for
outbreaks. I have a question on the community outbreaks, and that's, you know, if it's 3 or more people, 3 or more households, I guess, connected with either a business or a restaurant or something like that, how is it that we, I don't know, kind of factor in the point that some establishments have 6 employees, some establishments have 60, some have 600, and yet if any one of those has more than 3 outbreaks in separate households, it's considered a community outbreak. How do you kind of write that, or with the with an entity that has a lot of employees versus somebody that has very few?
The definition for community outbreaks is determined by the Council for State Epidemiologists. territorial state epidemiologists and the Centers for Disease Control. The determination of outbreak does not depend on the number of employees or the number of patrons. It depends upon the number of cases in any given facility that are associated with that facility, but individuals are not from the same household. So the epidemiological link has to be determined to be the location or the setting, and those three entities have to be from different households. If they were from the same household, it could have spread, say, from person to person, from a spouse, an individual to their spouse or to another family member. But these have to be three distinctly different households or individuals associated with the setting that's identified.
I get that. It just seems, and I know that's somebody else's definition. It just seems kind of skewed, the fact that, if you have a lot of employees, it'd be a lot easier to get to that 3 as opposed to if you have very few employees, and yet the same equation applies. So I get it. It's not your definition, but it just seems that one could use some massaging, I think, in some cases. And then on.
I just wanted to add that the 3 cases have to have occurred in the last 14 days. So if there's 3 cases, say, over 2 months, it has to be in the last 14 days.
Okay, thank you. That clarifies a bit. All right, thank you. And then on the compliance health order, I forgot who it was that was speaking on that, but I think for the tier 1 complaints, you gave it a few examples. Example would be an indoor gym, an indoor salon, or assembly. Is that an indoor assembly or is that an outdoor assembly? I'm just kind of curious because we've had quite a few assemblies here lately, and I don't know if that's under tier 1, if that's indoor or outdoor.
Through the chair, apologies, Supervisor. Yes, it is indoor assembly.
Okay, all right, cool. All right, thank you. All right, I appreciate, and Mr. Chair, I guess after the speakers, I'd be happy to make a motion after we hear them. Thank you.
Very good. Are there any other questions to staff?
Chairman, I just wanted to bring up at this point in time before the speakers, as indicated in the presentation today, I was the motion maker on the statistician. I am indeed interested in a roundtable discussion, as pointed out by the CAO, during our September COVID update. So this discussion would include a look at unemployment, our impact to schools and mental health, and other pertinent areas. This will give us a holistic view of how we're doing as a region. I think it would be perfectly appropriate for that September meeting. So however we move forward today, I just want to keep in mind my request to the board to include that panel discussion for September. Thank you.
Very good. Thank you, Supervisor. Any other questions to staff? If not, then we'll go ahead and proceed to the one group presentation. We'll allow them 10 minutes, and then we'll get into the individual speakers.
Thank you, Chairman Cox. I will note that we received 44 e-comments on this item. We have 21 individuals that have called in to address the board. That includes the 3 individuals that are providing a group presentation. We'll be calling speakers by the last 4 digits of their phone number, and again, we'll begin with the group presentation. You'll hear a notification that your call has been unmuted. Each caller will be asked to state their name for the record. And for the group, you'll have 10 minutes to address the board, and you'll hear this sound when your time is up, so please conclude your comments at that time. Now, to remind the public speakers that they should mute their TV or live video stream before they begin speaking. Erin, if we could begin with the group presentation.
Yes, we'll unmute all the members of the group simultaneously. If you could each please state your name for the record, and then because the video has been limited to, or the group presentation has been limited to 10 minutes, we'll be starting your video at the 1 minute and 28 second mark per your earlier request today.
Hi, this is Justin Park. I'll let Darlene announce herself too.
Thank you and good afternoon, members of the Board of Supervisors and Dr. Wooten. I'm Darlene Pigeon, and we do have a video that we put together for you to review.
And this is Justin Hart. I'm a resident here in San Diego. I give a brief introduction in the video as well, but thank you for allowing our comments today.
And the Board of Supervisors, this is Amy Peltakian, and thank you again for hearing our presentation.
Thank you. We'll be playing the video now.
With that, I'm going to turn it over to Darlene Pigeon. And again, we thank you for your time.
Thank you Supervisors and Dr. Wooten. I'm Darlene Pigeon, and I'm addressing you today as I represent a constituency base from every district comprised of Democrats, Republicans, and independents, many of whom are industry leaders, business owners, and healthcare professionals. We are in agreement with the county supervisors that greater transparency is needed in the data being used to reopen the businesses and schools. The public health orders identify extremely low triggers that absolutely guarantee clawbacks leading to an extended lockdown with no end date in sight. These lockdowns are not only ineffective, they are unprecedented when dealing with viruses. It is common knowledge that there are people who have reported they have COVID, yet they received a letter stating their test came back positive. And it's also been documented that the CDC has reported that 98% positive cases, when in fact 9.8% positive cases. Additionally, healthcare professionals stated that COVID tests were inaccurate and fatality counts were included in the case counts. The state of California is basing San Diego County's emergency status on the case rate per 100,000 while ignoring the recovery and actual number of deaths. Each of you has visibility into the COVID-caused deaths in San Diego, which are less than 30, and yet we know roughly 120 people have died from the flu this year. We're taking these extreme measures for COVID. You cannot contain the virus, you can only delay one. Individuals have a higher risk of mortality from dozens of other causes besides COVID-19. Children have a higher risk of being struck by lightning. And we also know that suicide rates are spiking at a higher rate of COVID. Specific to the metrics you as a relying upon for the lockdown have thresholds that are unrealistic for outbreaks cases for a population of 3.5 million. San Diego death rates have been consistently low and our hospitalizations have been flat. It's unwarranted to portray San Diego as having a growing COVID risk for our citizens. COVID testing is being done mandatorily and more than once for all inpatient, all outpatient, all testing facilities, as well as for caregivers and medical professionals. The Department of Consumer Affairs released a memo to all healthcare practitioners to inform them that they can return to work after testing positive so long as they are asymptomatic. The antibodies in the individual for a couple of months or more, adding to the case counts. The rising case counts are not only predictable, it should not be viewed as an emergency, as high survival rates of 9.7% have proven that COVID is a lower health risk than other health risks that San Diegans manage every day.
So we're experiencing some bandwidth issues in the chamber, so we're going to try pausing the video for a moment while we let it load.
Today, we are here to ask each of you to require Dr. Wooten to provide the following: identify and state actual death numbers in San Diego, not COVID deaths of individuals from comorbidities or from repeat testing of the same individual. Since January of this year, 26 or 0.0007% of actual COVID deaths were reported out of San Diego's 3.5 million population. Just as you have stated in interviews, concur that more transparency is needed in the case reports. For example, cases need to be clarified, asymptomatic, where there's no treatment required, versus symptomatic or where treatment is provided, and that recovery rates are clearly stated. Additionally, timely information of all community outbreaks at the time they are reported. Outbreak is in a business where those individuals employees, or were they clients of the establishment? Ask the Board of Supervisors to write the governor for the following. Change highly unrealistic case rates. It takes a low threshold of 7 or 0.0002% of test results out of San Diego's 3.5 million population to guarantee a clawback and extend the lockdown due to a dimmer switch was set to low. Over half of California counties are on the monitoring list. That's a clear indication that statewide, all of the thresholds were set too low. And just as thresholds were set too low earlier in COVID, and you wrote to Governor Newsom, we request the relief to change the thresholds again. Thank you very much.
Thank you, Darlene. We're going to turn it over to Justin Hart now.
Hello, my name is Justin Hart. I'm a resident of San Diego. I'm a professional data analyst and machine learning expert. And I've used my skills to identify some of the challenges we have dealing with this disease. But I come to you mostly as a father at this moment. They say it takes about 10,000 hours to become an expert in any subject, an instrument, technology. But because of the COVID-19 school shutdown, by the end of September, our kids will have lost about 1,000 hours of classroom learning. And that's just the beginning of the terrible impacts on our children. Just north of us in Los Angeles, 32% of students never attended a single distance learning online class. Meanwhile, others have noted the study out of the University of Michigan that domestic abuse cases have skyrocketed across the country. And to be sure, this is a challenging situation. This virus has attacked the world, but we know a lot about it today. And out of the tens of thousands of deaths that have impacted us here as Americans, very few have been of high school, middle school, or grade school age. The impact of the school shutdowns, though, have affected millions of children. Consider this, over a given year, between 4,000 and 6,000 high schoolers will take their own lives in suicide. A simple 1% uptick caused and prompted by these shutdowns and the cultural impact and psychological impact that that has. A 1% uptick will completely eclipse all of the COVID-19 deaths of that same age bracket. Unlike common diseases like influenza and pneumonia, COVID-19, thankfully, largely spares our youth, which is why it's so important to get them back into the classroom. Studies have shown that children are not major infection points of the disease. The director of the CDC came out this week. He says, quote, I don't think I emphasized enough as director of the Centers for Disease Control, the leading public health agency in the world. He continues, it is in the public health interest that these K-12 students get schools back for face-to-face learning. Almost all officials have concluded the same to the effect there. The impact on our children, according to the University of Michigan, Florida State University, found that in March and April, an estimated 212,500 allegations of child abuse went unreported because of school closures. The risk of COVID-19 is also extremely low for kids, as we have noted. Quote, and based on the data, so extremely low risk of children. It is unbelievably low risk. This quote continues, the group of kids are staggeringly safe in general. Nobody has ever been safer in the history of humanity than these kids. That was David Spiegelhalter. He's the chair of the Winton Center for Risk and Evidence Communication out of Cambridge. Children are also not major spreaders of the disease. Quote, children under 10 are less likely to get infected than adults, and if they get infected, they are less likely to get it seriously ill. What's interesting, this quote continues, is that even if children get infected, they are less likely to transmit the disease to others than adults. We have not found a single instance of a child infecting parents. The Icelandic study, this is from the Icelandic study, and it was important because it was a genome sequence study, which allowed them statistically to identify the threads of where the infections came from. Another study out of Germany, led by Professor Berner, he indicates that it's the opposite of what we expected. Children act as a brake on the infection. Not every infection reaches them that is passed on. The UK indicates that there has been no recorded case of a teacher catching coronavirus from a pupil anywhere in the world. And according to one of the government's leading scientific advisors, Mark Woolhouse of the UK, he's a leading epidemiologist, a member of the government SAGE committee. He told the Times it may have been a mistake to close schools in March altogether. For us adults, let's be adults. The risks are frankly very low. If you're under the age of 45, according to Professor John Ioannidis, one of the most hated scientists in the world out of Stanford University, if you're under the age of 45, the risks of succumbing to COVID-19 are almost zero. He goes on to note that if you're under the age of 65, the chances of dying from COVID are the same chances you face on running your commute every day in a car to work. And if you're over the age of 65, it's still fairly low, about the same risks that a professional trucker would face if he's on a job on a daily basis. It's time we recognize that the impacts are thankfully very low for our children, but the impacts of keeping the schools closed are devastating. They are life-changing. Just today, I read an article, an 11-year-old boy faced with isolation, he took his own life. And there will be dozens more of those reported cases. We need these schools for our kids. It affects all of them dramatically. It's time to go back to school, and it's time to give them back their lives. Thank you.
Thank you. Next, we'll turn to our individual speakers on this item, beginning with 0097.
Good afternoon. This is Brittany Sylvia. Thank you for the opportunity to speak today. I'm calling to fervently support and advocate for waivers for our schools to open for in-person learning. I'm an active duty military spouse. Since the governor's announcement closing schools, I have been overwhelmed by the heartache and pleas of other military spouses that do not know what they are going to do. Our military members leave and deploy for long periods of time for dangerous work. They are essential workers and cannot stay home and supervise young children. The families left behind have no safety net. We have no extended family nearby. Our children are some of the most resilient and tough kids you will ever meet, but this has nearly broken them. My own children broke down and sobbed when I told them that they could not go back to school. Our children, especially our young children, need in-person learning. They cannot sit at a table and stare at a computer for 6 hours a day. They need a teacher and they need to be in a classroom. The governor has allowed for waivers, and I'm desperately asking the health officer and the board of supervisors to approve those waivers. If school districts and schools can demonstrate they can meet the CDC and state guidelines, please allow them to open. Please allow our children not to fall farther and farther behind. Our young children especially will be harmed by not being in the classroom. Our children need interaction. They need teachers. School is essential. YouTube videos and worksheets do not take place of the wonderful work that is done at school. We know that the education gap will widen to a degree we cannot bridge for the vast majority of our children if they cannot be in the classroom. I speak not only as a parent, but as a teacher myself, and I want to be back in the classroom. I know teachers are putting in long hours for very little educational gains with virtual learning. It does not work. Teachers want to be in the classroom with their students. Parents want their children in the classroom. Children cannot be left home and have the computer take the place of a supervisor. Our children are not okay. They are not flourishing. They are isolated, lonely, and depressed. Many are hungry and not safe at home. They have lost months of learning, and they are not receiving their services. Please approve these waivers.
Ma'am, please conclude your comments. Your time is up.
Thank you.
Thank you. Our next speaker is 0542.
Hi, my name is Jessica Paskovich. Honestly, this seems a little pointless because the vast majority of calls and e-comments for months have been begging you guys to let us provide for our families, informing you of the the destruction that you have caused in this county, and even providing some proof that you are wrong about things. But I would like to point out a correlation in one of Dr. Wooten's slides about community outbreaks. It shows that the more strict we are locked down, there's an increase in community outbreaks. I mean, we originally shut down in mid-March, and we see an increase in April. We shut back down to an extent in early July, and July's community outbreaks skyrocketed. So this is kind of an indication that it's either not a good thing to measure this virus by, or the shutdowns don't work. I'd also like to point out some hypocrisy. Helen was talking to someone on the video earlier this morning within 3 feet of someone without a mask on, and you guys do this during your daily press conferences when you're walking back and forth to the podium. You cross paths without putting your mask back on. Also, I'd like to say that once a month meetings during a pandemic is not acceptable. We can't keep waiting this long in between our chance to talk to you and try to get action taken. That's it. Thank you.
Thank you. Our next speaker is 1022. If not, we'll move on to 1068. 1068, you appear to be muted.
Debbie, after all these years back and forth about whether or not dextromethorphan helps for methotrexate leukoencephalopathy, do you feel that like it adds much or not really?
I believe that caller's on another call right now, so we'll come back to that person. Our next one is 1491.
Hello, good afternoon. My name is Ken Caravantes, and I'm a member of ACE. I'm a resident of National City. And, well, I wanted to ask you guys for help, well, like, to, like, support ACE because, you know, they've helped me out a lot. I'm a musician. I don't get that much money because of the pandemic. I can't even work right now. And I would, like, want you guys to, like, invest at least 100 million to help people like me who can't work, who can't help out, like, you know, like our own families and we're struggling, you know, with like for rent and stuff like that, or to like at least for students or something, you know. I really appreciate you guys help us out during the pandemic and stuff, and yeah, thank you for letting me speak.
Thank you. Our next speaker is 1795.
Hi, my name is Ana Laura Martinez. I'm a resident of District 1 and a member of the Center on Policy Initiative, part of the Invest in San Diego Families Coalition. The Board of Supervisors has not done enough to protect workers. We need standards in place for workers right now and when other industries reopen. Recently, businesses in San Diego County have been highlighted for their lack of compliance with state and county orders intended to facilitate a safe reopening of businesses for both workers and consumers. Even with current rules, regulations, and enforcement, San Diego County still has experienced 235 community outbreaks. While law enforcement has been working to answer complaints from the community about businesses out of compliance with COVID-19 response guidelines, only 144 citations have been issued. The district attorney is still the only responsible entity tasked with following through on enforcement. Restaurants, gyms, retail stores, and other businesses are places where workers can get infected, spread it to their coworkers, and bring it home to their families. The county must ensure that all workers, regardless of gender identity, racial and ethnic identity, or immigration status, have proper PPE, paid sick leave, and that their workplaces have proper health and safety measures in place. We call on the County Board of Supervisors to initiate an Office of Labor Standards and Enforcement to uphold worker standards and help effectively enforce COVID-19 response measures throughout the county. Thank you. Have a good day.
Thank you. Our next speaker is 1934. One 934. going to move on to the next caller, 2465.
Hi, my name is Edie. Let's talk simple facts. Viruses cannot be contained. There's no guarantee that an effective COVID-19 vaccine will be developed. Effective treatments to combat COVID-19 are available. Japan, with its 100% mask compliance, is seeing an uptick in daily confirmed cases. There is always a vulnerable population susceptible to every virus. We know who is most vulnerable to COVID-19. There is a difference between communicating physical distancing for safety and enforcing social distancing, which is isolation. So what do? We need reliable facts. We need our elected officials to work together to implement workable solutions. We need our personal physicians to have all the information and tools necessary to work with us to make our individual healthcare decisions. We do not need editorializing from our government officials. For example, being saddened by an outdoor church service. San Diego County should request that the governor change the case rate per 100,000 population metric that has us on the state monitoring list. Anything short will leave us closed for the foreseeable future. Have we considered where the money will come from to pay for the expenses incurred, or are we planning on kicking that can down the road to become a mini version of Argentina, now resolving its debt crisis for the third time since 2000? If we protected the vulnerable and reopened schools and businesses, at least we would no longer be adding to that IOU. Am I correct? So please use facts. If you need assistance, there are plenty of capable people in the local community available to help. Let's work together to develop solutions like testing at the border. Choose your words and actions carefully. They have consequences. Please work on behalf of your electorate to safely reopen San Diego. Thank you for your time.
Thank you. Our next speaker is 3583.
Hello, my name is Anaisa Alegria. I am part of District 1. I'm part of ACE as well as the San Diego Invest in Families Coalition. I wanted to talk about housing and how there's a lot of individuals right now who are competing with homelessness. Before even COVID happened, I actually had a student that was living in a shack with his mother. And this was prior to COVID, I just want to state that. And during raining season, sometimes his little shack would get flooded. So he would come to school with wet clothing or dirty laundry. And it wasn't until he let us know, of course, CP, the Child Protective Services were announced, but that does not fix the whole problem, considering that homelessness isn't fixed just by calling Child Protective Services. So I wanted to bring into conversation the fact that a lot of people are struggling right now. So we need more rental assistance. We need to allocate funding for orgs that provide tenant counseling. So many tenants do not know what their rights are as renters. Likewise, counseling needs to continue providing that. That's what we need. We also need to provide assistance to our undocumented county residents, who I will remind you are county residents who are also paying for our taxes. They have been excluded from state and federal aid. Please cancel rent. Please cancel mortgages. We can't pay when we're so focused on not dying and catching this virus, as well as we're focused on trying to find another job. So please listen to what your constituents are saying. Thank you.
Thank you. Our next caller is 4024.
Hi, my name's Jim Walker. I'm a director at the Convair Sailing Club. The Convair Sailing Club is a nonprofit club with 16 sailboats docked at the Harbor Island Marina. And we provide the San Diego area with an affordable sailing option for pleasure and racing. And the club is open to anyone to join. Our club and boating in general contributes significantly to the San Diego economy. You know, not only are through our operational budget, but boaters spend more when their boats are being used. The county limitation on non-family members has strangled the club and what we offer the community. Membership is down 25%. All races and activities are canceled. Prospective members cannot be checked out. And our club finances are marginal. And frankly, sailing single-handed or with inexperienced family members can be unsafe. We strongly urge the county to allow non-family members on board on the conditions of following specific COVID-19 safety protocols. Our boats are smaller, So we will be outside all the time with a maximum of 4 people on board. Masks are, of course, mandatory on board and at the dock, along with hand sanitizer on board. And boats will be cleaned between use. We will not hold the club's usual social events. A log will be kept for all persons on board with contact information. The Converse Sailing Club can safely operate under these conditions without creating a greater stress on San Diego's healthcare facilities. Again, we strongly urge the county supervisors to allow non-family members on board for our club and boating in general for the economic and recreational aspects, along with the stress release we all need right now. Thank you.
Thank you. Our next speaker is 5010.
Good afternoon, board members. My name is Colleen Cook, and I am part of the San Diego Association of Yacht Clubs and a member of the Cortez Racing Association and Southwestern Yacht Club. I am asking you to consider revising your restrictions on recreational boating. As a retired teacher, I know that when rules are not reasonable, people will respond with rebellion, not cooperation. We have all likely seen the flagrant violation of the current household-only restriction on recreational boating. The SDAYC is interested to work with your health team to create safe boating guidelines. We are ready to take the lead and feel this is a very promising opportunity as we see that boating carries a lower risk, for example, than sitting outside as my hairdresser works on me for an hour. Recommendations for safe boating have previously been sent to you and could include such things as the wearing of mask coverings, registration of all persons on board, and even limiting the number of persons on board based on the size of the boat. We look forward to working with you. Thank you for the work you do on behalf of the safety of this county. Thank you.
Thank you. Our next speaker is 5047.
Well, thank you. My name is Bill Edwards. I'm Rear Commodore of the Board of Directors of San Diego Association of Yacht Clubs, which includes member yacht clubs from Oceanside to Chula Vista. We've recently formed a boating freedom committee to address perceived inequities as it relates to recreational and competitive boating in our county. I am the chair of this committee. I was very pleased to hear Wilma Wooten talk about the outbreaks, and not one instance of boating outbreaks have occurred, according to her briefing, which is important to the rest of my dialogue. The committee's mission is to open a dialogue with County Board of Supervisors about reopening recreational boating in San Diego County for all skippers to invite non-household members and family members not residing in their households aboard the boats for recreational competitive boats. Non-household persons and family members are allowed to congregate at grocery stores, Target, Walmart, retail shopping outlets, outside dining at restaurants, inside when the dimming order is lifted, for hire boat charters, harbor cruises, and thrill rides on San Diego Bay with approved protocol in place to mitigate the propagation of COVID-19. We believe many of the same protocols can be put in place to support recreational boating that will satisfy the Board of Supervisors and the county health officials. Attempts to open a dialogue with county health officials have been met with little responsiveness. Our community believes that when protocols for recreational boating are negotiated and accepted by our boaters and county health officials, contact tracing would be much easier for all should a person contract COVID during recreational boating when compared to a person that has been to a bar, restaurant, bay cruise, or other activity where much larger groups of people gather together. The Boating Freedom Committee is committed to educating our community beyond the San Diego Association of Yacht Clubs community, and to that end has invited the Port Tennis Association to join the Boating Freedom Committee to help disseminate educational material and COVID protocols for recreation boating to boaters not under the umbrella of San Diego Association of Yacht Clubs. The president of the Port Tennis Association will not be addressing you today with regard to this matter, as a scheduling of agenda item 2 created a conflict. And if I could, I'd finally like to have one final 10 seconds. Finally, during a conversation with the chairman's staff, I was referred to the state's COVID-19 industry guidance, campgrounds, RV parks, and outdoor recreation as a reason non-hold members are prohibited on our boats.
Sir,
please note that the word boat and recreation are not seen together in this document, and the page I was referred to is directed at limited capacity, small group guided fishing, hunting, and chartered boat trips.
Sir.
Thank you for your attention to this matter.
Thank you.
Thank you. Our next speaker is 5587.
My name is Dr. Holly Yang, and I am president of the San Diego County Medical Society, representing 4,600 active and retired physicians and trainees in San Diego. Additionally, I'm a clinically active palliative care physician and have seen the impact of COVID on my patients and have cared for people with COVID-19 in hospitals across our county. I want to acknowledge the significant economic hardship and deep suffering that has occurred due to this pandemic. As you know, we cannot get back to a healthy economy without control of this disease. We should use caution in reopening with time to see the effect of each action. And at the same time, we must minimize the impact to people at risk of losing housing, those with food insecurity, and those who are isolated and in need of mental health support. I am calling in today to strongly encourage the board to continue to follow the science and listen to physicians, scientists, and your public health officials to minimize the damage to the health and welfare of our community, especially those people experiencing health disparities, including our communities of color, people with disabilities, and older adults. I urge you to do everything possible to continue to support public health, including educating and assisting our community to comply with health orders, and when necessary, enforcing health orders so that we can reopen our community safely, avoid healthcare system overwhelm, and ensure that vulnerable populations and essential workers, including healthcare workers, are protected. Thank you.
Thank you. Our next speaker is 5590.
Good afternoon. Thank you for the opportunity to be heard. I'm Lisa Clements, Vice Commodore of Silvergate Yacht Club and member club of SDAYC. The restrictions on boating activities have significantly negatively impacted members of the community by forcing Silvergate to cancel 2 of its charitable events. I'd like to briefly describe these events for you. First, our wheelchair regatta. For 60 years, owners and skippers of more than 30 large power boats donate their time, fuel, energy, and boat to giving 90-minute tours of San Diego Bay to more than 400 handicapped individuals and a caregiver. For many of these guests, this is the only time they leave their residential facility all year long, and they look forward to it each year. The second event is the America's Schooner Cup Regatta. For 32 years, this event has brought owners and skippers and crews of schooners together for a regatta in San Diego Bay. This is a 3-day event, which includes a seminar, dinner, silent auction, the regatta itself, and an awards ceremony. The community enjoys watching this regatta at no cost, and printed programs are available detailing the history of these wonderful ships. The proceeds of this event go to the Navy Marine Corps Relief Society, which supports our military and their families in times of need. Historically, we raise between $30,000 and $35,000 for this charity through the America's Schooner Cup event. These funds are very important to the Navy Marine Corps Relief Society, and this event is one of its major sponsors and sources of support, and especially right now with the fire on the Bonhomme Richard, these people are in need of so much. I hope that this information will help you to understand how the inability for boaters to be on a boat with non-household members has had a severe negative impact on the lives of innumerable individuals in the San Diego community. Thank you.
Thank you. Our next speaker is 6050.
Good afternoon. My name is Michael Kirchgessner. I'm the Commodore of Point Loma Yacht Club, and we are members of San Diego Association of Yacht Clubs. At last month's board meeting, I spoke about recreational boating in general and how the restrictions on the crew members affect it. This week, I would like to address a very special part of the whole issue. That is the impact of these restrictions have on the sailors of Challenged Sailors of San Diego. As the name suggests, these special people have certain challenges in their lives. CCSD offers these sailors the opportunity to meet these challenges in a manner that is essential for their mental health as well as their physical health. You may not be aware, but these sailors sail in specially adapted Martin 16 sailboats. One of the requirements of CCSD is that these sailors be accompanied by a companion sailor when they venture into the bay. These companions are experienced sailors, not household members. Due to the restriction on recreational sailing, CSSD sailors and their boats are beached. This needs a resolution. Thank you very much.
Thank you. Our next caller is 6631.
That's me right there. My name is Barbara Pinto, and I am a member of ACE and a member of the 1st District. I am a senior citizen, and I'm on the board that serves on the ACE committee. Invest in San Diego Families Coalition also participate in that. We're asking the county allot at least $1 million, no less than that, for the rental assistance program. There are millions of renters in San Diego County, and thousands upon thousands of these people are unemployed due to this state of emergency, the COVID-19, of which we are not responsible and have no control. Please invest in our communities and keep families in their homes and families together. Do not add to this already horrific crisis by allowing countless evictions and division of families and households. Hundreds of people called in asking the city for a reasonable allotment of $70 million for the rental assistance program. We only got $15 million. That was not nearly enough money to help these people in need. This money does not go to the renters. It goes to the landlords for their losses and for their mortgages. We are still hard pressed to meet all of our expenses with no jobs. Early returns to work for some failed, and the pandemic spiked again. Please consider the needs of the majority, which would include a board for rental counseling and the cancellation of rents and mortgages, not deferments, until this pandemic is under some kind of control and the leadership can come up with reasonable solutions for all. Thank you.
Thank you. Our next caller is 6789.
Hi, can you hear me?
We can.
Hi, I'm sorry, I have asthma, so just bear with me. My name is Patricia Mendoza. I am a resident of District 1. I'm a member of ACE and a part of the Investment in San Diego Families Coalition. I'm sorry, I'm a single mother, a hardworking single mother of 2 children. And because of COVID, I lost my job March 26th. It's not fair. I didn't cause this. And now I'm sick. I made an appointment to get tested, but I'm scared because I still don't have money to pay my rent. I don't want to get evicted. I don't want to tell my kids that we're going to be homeless. Because if there's an easy way of telling a child that you're going to be homeless, then please somebody share it with me. I'm calling today because I urge you, elected officials, to invest at least $1 million for rental assistance for people like me that can't go back to work.
Thank you.
Sorry.
Would you like the testimony?
I can't continue.
Okay, thank you so much for calling. Our next speaker is 7646.
Hi, this is Kelly Lauro. Thank you for letting me speak today. I have sent 17 emails beginning in June to the public health officer asking for an explanation of why COVID-19 test numbers, the test numbers, differ on the state of California website reporting and the county of San Diego reporting. The numbers differ by tens of thousands of tests. I did receive one email back in July stating that, quote, the county and the state are aware of the problem and are actively working to fix it. The numbers still differ today by tens of thousands of test numbers. The actual case numbers today I looked at as well are different by 110 cases. I really urge the County Board of Supervisors to hire an independent auditor to look at all numbers reported by the public health officer from all testing sites and hospitals, including test numbers, positive case numbers, and what exactly is included in these numbers. If there's any duplicate counting of people, we're being locked down because of these numbers, and there's something fishy going on there, and it needs to be audited. So I urge you strongly, Board of Supervisors, please do an independent audit of all these numbers. San Diego the businesses need to be open, schools need to be open. We need to get back to business and back to work. Please do an independent audit of all these numbers. And Public Health Officer, I urge you as well to put some perspective around your numbers. In April of this year, there were 1,988 deaths in this county, in San Diego County. Now, while that is tragic, only 113 of those deaths were from COVID. So you need to put perspective around the numbers you're putting out there, because San Diegans are in a panic, and 98% or more of people will live. We need to do the independent audit. Thank you, Supervisors.
Thank you. Our next caller is 5926. Can you unmute your device, please? We're having trouble hearing you. We'll try coming back to you later. Next caller is 9343.
Good afternoon. My name is Michelle Krug, and I just want to give the other perspective of consequences. What is it going to feel like for a child who winds up getting COVID? And I do personally know 2 classified employees that have gotten COVID from being at school. But if a child gets COVID and then winds up infecting their grandparents and their grandparents pass on, what kind of mental health consequences does that have for the rest of the child's life? So you've got to look at the unintended consequences as well as your immediate needs. I also want to just comment on the senior program at your last week at your COVID update at the press conference. You encouraged seniors who did not have fans to prepare for the heat wave and to ask for fans from Aging and Independent Services. I was very disappointed to find out when I called that there was an income limitation, which was not stated. They just said, seniors call, and I cannot leave my house. I have no way of getting anywhere to get anything. I didn't, I'm just over the income limitation. But to me, in a pandemic, the focus should be on helping people and not limiting them. Thank you very much.
Thank you. Our next caller is 9719.
Hola, muy buenas tardes. Intérprete, please.
Hola, buenas tardes. ¿Cuál es su nombre?
Mi nombre es Javier.
Ok, Javier, puedes comenzar. Sí te pido que tomes unas pausas para que pueda traducirte. Adelante.
Claro. Hola, muy buenas tardes. Mi nombre es Javier.
Good afternoon. My name is Javier.
Y soy residente del distrito número 1. Soy miembro de ACE.
I am a resident of District 1 and a member of ACE.
Y a la coalición invierte en las familias de San Diego.
And in the Invest in San Diego Families Coalition.
Necesitamos que inviertan por lo menos 100 millones para ayudar a personas que no pueden pagar la renta.
We need you to invest at least $100 million to help people who cannot pay their rent.
Por la pandemia, designen fondos para apoyar a las organizaciones.
Due to the pandemic, we need you to assign funds to help organizations that help people.
Que dan consejería legal para inquilinos.
And then offer legal advice to renters.
Inviertan dinero para ayudar a las familias indocumentadas que fueron injustamente excluidas.
¿Dijo familias indocumentadas?
Sí, familias indocumentadas.
And invest in undocumented families that were excluded from other assistance.
Es ahora que nuestros representantes se unan con las personas que más los necesitan.
And then our representatives be able to meet with people that are in most need of assistance.
Necesitamos que nos apoyen en la cancelación de pagos de renta de hipoteca, por favor.
We need your support in helping with cancellation of rent and mortgages, please.
Para que todos los que no puedan pagar por la pandemia. Gracias.
For everyone that cannot make those payments due to the pandemic. Thank you.
Thank you. Our next caller is 2749.
Okay, my name is Victor Valle. Hello?
Hello, we can hear you.
Yes. Okay, I'm sorry. My name is Victor Valle. I'm with ACE, National City. Right now, with this pandemic, a lot of people suffering. I know that business owners, homeowners, landlords, especially tenants, that they're really trying to make the payments towards whatever to eat or to rent. And right now, it's really hard for everybody, even just to get a job. And even if I get a job, it doesn't mean that next day they're going to pay me $3,000 just to pay up the rent. So it's impossible. Also, the government sent $1,200 for right now. I don't know how many months the pandemic has been. So with that in mind, is that it's kind of hard right now, the living for anybody, homeowner, landlords, and renters, and whoever is working. So I would say at least please cancel the rent and cancel the mortgage. That way they can have some breathing time so they can, get some money or they get a job or something, and they will be able to pay your mortgage or your rental or whatever bills that you might come. Even $1,200, it will not take you over 5 months. It's just for a temporary thing. And not that many people or not that many jobs are opening. So I believe that canceling the rent and the mortgage will help us here in the community. Thank you.
Thank you. Our next speaker is 1022. 1022, would you like to address the board on item 2, the COVID update? If not, 1934. 1934. 5926. 5926. We'll move on to 2432.
Hi, my name is Diane Ake. I work with Reopen San Diego. People are really hurting. The lockdowns are killing us. There's been only 565 supposed COVID deaths. There's 3.7 million people in our county. But you're destroying our economy, destroying lives, destroying businesses for 565 deaths. We're down 153,000 jobs. Unemployment is almost 14%. It was 3.3% last year. It's estimated 1 in 6 people in San Diego County are going hungry. And Dr. Wooten has not provided any statistics today or at any time showing that there's any type of emergency. About the same number of people who died February through June of last year died this year. There's no emergency. A case means nothing if people have no symptoms and aren't dying. People have all sorts of viruses all the time. Please look into your hearts and do the right thing. I know you want the money from the state, so you follow their guidelines, but the state can't provide us with nearly enough money to feed and house people who are not allowed to work. If you just let businesses fully reopen and let people exercise their constitutional right to work, we could solve the financial problems immediately and much better than any state handouts can. The few crumbs they offer isn't worth it. Financial independence and economic stability is the solution. Please do what you know is right for us and stop driving people crazy and destroying the soul of our county. Open the schools immediately, call an emergency board meeting, and ask for the state to change their metrics to be something reasonable so we can reopen. I know that you know what the right thing is to do. Don't get sidetracked by the lure of state money or federal money or anything like that. Thank you.
Thank you. Our next caller is 1990.
Hi, my name is Patricia Duran, and I'm part of ACE, and I'm also part of Parent Voices, and I work with 200 families, and I want to say that rental assistance is definitely needed right now during this pandemic. It isn't something that anybody asked for. We all know it's a state of an emergency, and we've all had to shelter in place. People have lost their jobs. People aren't able to work, and we need the cancellation of rent and mortgages, or invest $100 million in rental assistance that can be paid to those landlords. I was at an event on Friday against Capital Growth. They received $350 million of money from the federal government for a bailout. But we have people that are homeless. We have people that are stressing because and having anxiety because they can't come up with rent. I'm speaking with families. They're not, feeding their families because they're worried about getting evicted. This is this is something that needs attention, and it needs your attention because we voted for all of you. And I know the county of San Diego has a rainy day fund. This is a rainy day. We didn't expect coronavirus, and we're all having to do it. I'm able to pay my rent. I'm able to go to work, but not everybody else is. And we have to look at everybody else, not these individual people that are worried about taking their boat out. We have to worry about people paying their rent. We have to worry about people putting food on their table. So please take this into consideration. I thank you very much for your time.
Thank you. And our final speaker is 5362.
Good afternoon, Board of Supervisors. My name is Judith Howell, and I'm a resident of District 4, a community advocate for Planned Parenthood of the Pacific Southwest, and part of the Invest in San Diego Families Coalition. The Invest in San Diego Families Coalition is continuing its call for the county to invest in programs and services that support healthier, sustainable, and thriving communities for all working families, especially for Black, Brown, Indigenous, and poor families. The COVID-19 crisis and its disproportionate spread and impact in our communities is the direct result of the massive social and economic inequality that has always existed in our county. The decisions you make now will help maintain the status quo or help build a just and equitable county. I urge you to support in the Invest in San Diego Families Coalition demands, and I'll just list 3 for this call. Create a rental assistance program to help people stay in their homes and require every landlord receiving rent relief provide healthy and safe housing. Second, allocate funding for organizations that provide tenant counseling, outreach, and education, and legal services for tenants. Lastly, divest money from the budget for the sheriff and county jails and invest those funds in non-law enforcement alternatives. Thank you so much.
Thank you. We have a couple more speakers who just called in for this item. We have 5926. Your device is muted.
¿Aló?
Hello.
Aló. Mi nombre es María Cisneros y ocupo un intérprete.
Adelante, señora.
Ok, permítame. Permítame un momentito, permítame.
Está bien, solo le voy a pedir que tome unas pausas para que la pueda traducir.
Sí, está bien, ya ocupo mis lentes para mirar. Espérame. Buenos días, buenas tardes, mi nombre es María Isabel Cisneros, soy del Distrito 1 de San Diego, California.
Good afternoon. My name is Maria Isabel Cisneros, and I am from District 1 in San Diego, California.
La llamada mía es para ver si nos pueden ayudar a todas las familias que estamos necesitadas por esa desgracia que pasó mundialmente, ¿verdad? Ojalá que si no tuviéramos nadie en necesidad de andar pidiendo ayuda, le aseguro que nadie lo hubiera atrevido a molestar a nadie. Y ojalá que nos apoyen con el dinero para que todas las familias necesitadas puedan recibir esa ayuda, que no va a ser permanente, no va a ser toda la vida, va a ser temporalmente, ¿verdad?
My call is to ask that you help all the needy families that are facing this global disaster. Believe me, if we didn't have the need, nobody would be bothering you today with this request. Hopefully you will have the funds and be able to assist us and understand that this is not a permanent request, but just a temporary one.
¿Puedo seguir hablando?
Sí.
Ok. Pues espero que nos ayuden, ¿verdad? Y yo sé que mundialmente es la ayuda, pero no es para todos, nada más para las personas más necesitadas que estamos en San Diego. Espero mucho que de verdad sí nos apoyen a todas las familias que están necesitadas. De verdad que se los pido en nombre de todos que nos apoyen. Es una necesidad muy grande que yo pienso que las personas que tienen dinero, gracias a Dios, pues ellos no tienen la necesidad que tienen otras gentes pobres, ¿verdad? Que están a día con su cheque y que una gente pues no trabaja, pues no pueden recibir cheque, andan pidiendo comida, andan pidiendo prestado a los familiares que los puedan apoyar. Es una cosa muy fea, pero es triste y desgraciadamente la que los lleva son los niños chiquitos, que los papás pues no pueden, los niños están oyendo problemas que no deben de escuchar.
Okay, so I really hope that you will be able to help, especially those families that are most in need here in San Diego. I hope that you realize that we have a very great need for assistance and that those people, and to really focus on those that have the highest need, because there's a lot of people in San Diego that do have the money that aren't struggling like some families to meet their day-to-day needs. And when that happens and they can't go to work, they're asking for food, they're borrowing money from family, they're asking for other types of help. It's really an ugly situation, and a lot of them have small children who are now even hearing conversations that they should never have to be a part of. ¿Terminó, señora?
Sí, ya me queda una palabra más. Solo le quiero decir a las personas indicadas que están escuchando lo que estoy diciendo yo sé que todas las familias podemos decir cosas diferentes, pero todas son tristes a la vez. Y espero que por favor nos apoyen esta vez. Que lo vuelvo a repetir, no va a ser permanente. Es solo una vez que nos apoyen. Ojalá y no se vuelva a repetir esta tragedia. Gracias.
Gracias. And once again, to all of those that are listening, I really do request your support and reiterate that it is not a permanent thing, that hopefully that this will never happen again. This is a tragedy, a one-time tragedy, and that we really do need your support and help. Thank you.
Thank you. Our next speaker is 4728.
Hello, my name is Sylvia Saldivar, and I'm an organizer with ACE and a member of the ISDF Coalition. I'm calling in support of the ISD event demands and urging you to create a rental assistance program to help people stay in their homes. Especially during a pandemic, we need to ensure that people have safe housing and everyone has food and resources to support their families. I'm very disappointed at the folks that want to open schools and other businesses, while there's people on the south side of the county being disproportionately affected by this global pandemic. I'm sure sitting on a computer for a couple hours will be way less traumatizing than experiencing a death of a family member or having your child console their friend whose mother, father, family member has just passed away. What we really need is to keep families home and safe until it is safe for everyone. Yes, including the immunocompromised, since it seems to be a debate point for some folks calling in and even sitting on the board. We need to make sure everyone has a roof over their head and no one is evicted or harassed by their landlord. Prioritize rental relief for the people who are not able to pay rent after losing their jobs due to a pandemic, and also create a rental assistance program that is accessible to all. And yes, that includes the undocumented community. And if we can't work to create and work towards a rental assistance that includes everyone that you're supposed to be representing, then work towards canceling rent and mortgages. Thank you.
Thank you. And that concludes public testimony on this item, Chairman Cox.
Very good. We thank everyone for their input. Let me start off by asking staff if there's any additional comments or questions that were posed that they would care to respond to at this time, and then we'll get into the board discussion. Does staff have any response?
Yeah, Mr. Chair, I believe that Wilma addressed everything during her presentation, and Vince and Andy.
Very good. We'll go into board discussion, and I think Vice Chairman Desmond had asked to speak first on this item.
Well, thank you, Mr. Chair. I appreciate it. And I wanted to thank you, Dr. Wooten. I figured out that 240 number. You're right. So I apologize for questioning that, but I appreciate it. You know, throughout this pandemic, we've been learning about best practices ever since the virus started. And we need to thoughtfully apply what we've learned and how to prevent the spread and how to treat and who are more and who are less vulnerable throughout, you know, and who are vulnerable to long-term impacts. And until there's a vaccine, you know, we need to apply the knowledge that we have and learn to live with the coronavirus. I don't think we can continue to expect that people will stay shut away in their homes for any much more extended period of times, as we've seen and witnessed mostly on the freeways, as some of them are back to pre-COVID status. There shouldn't be a choice. It's really, we can protect the public health and we can have our economy open. These two are not exclusive. They actually depend upon each other. And people are desperate. They want to be responsible. They want to pay their rent. We just need to make sure that we keep them safe while giving them the opportunities for their jobs while keeping them safe. I know there's always going to be risks in life, and we need a smart approach to safely and responsibly allow openings for businesses, churches, recreational activities, including boating, weddings, and schools. My entire career as an airline pilot has been about understanding and minimizing risks safely. I keep hearing that we need to wait a few more weeks. Businesses don't have weeks. People need to pay their rent and their mortgage. They don't have weeks. Rent is due every month. And unfortunately, the hardest affected are those that earn the least. Our public health doctors in their system, they're doing great work. Our hospital capacity is doing well. We're still 60 to 70% capacity. We have over 20% of our hospital beds set aside, 1,200 beds in San Diego County for COVID patients. And even at the peak of our hospitalizations, we never even used half of them. Currently, there's only about 10 or 15% of those in the hospital are there for the coronavirus. And that's not to say this is not a deadly disease. I still maintain that we have to follow our public health officers' orders of mass social distancing and hand washing. It's our job as policymakers to make sure we're balancing the public health side and the economic side. So for schools, the majority of this board has consistently advocated for local control. And I believe we should be supportive of the local school districts applying for the waiver to allow the option for in-person classroom instruction. And I know it's not our decision as boards of supervisors, but I'd like to see us go on record of supporting this option of in-person school. And there's quite a few number of reasons for doing so. And I believe especially for the younger students, elementary school students, the children need social interaction, group activities, physical activities, learning how to mature socially. They're all extremely important parts of education. Schools also provide meals to students, and maybe it's their most nutritious meal of the day. School is where teachers find that a child may need a hearing aid or may need glasses or has a learning disability. And sadly, schools are the #1 reporter of child abuse. Many households need both parents working to afford a home. Many working parents need schools open so that they can put food on the table, to pay for a roof over their head, and receive health benefits. Data and facts show that children are at a much lower risk of contracting the virus and a much lower risk of serious illness if they do catch the virus. Children in school, however, if children go back to school, they need to be reminded to limit their contact with the most vulnerable, the elderly, and when doing so, wear masks, keep social distancing, and frequent hand washing. The distance learning actually, I think, denies our children essential mental, social, and physical outlets. But before the most recent shutdown, schools were offering the options to parents of classroom learning, distance learning, and homeschooling. So I'm supportive of allowing these options in the best interest for the schools. So I'd like to make a motion, first of all, to approve staff's recommendation and take additional action here as follows. As long as the state criteria is met, I'd like the board to take a position for local control in support of the waiver process that provides schools the option for in-person education. And under the compliance portion of this item, I want to make sure we're prioritizing stopping the spread of the virus with education and notifications instead of just compliance. So along with taking the position of support of the waiver process to provide schools an option for in-person education, I'd like to recommend to the staff to take the appropriate actions to approve phase 2, tier 1 of the compliance program. Mr. Chair, that ends my comments in motion.
Okay, we have a motion by Vice Chair Desmond. Is there a second to that motion?
I'll second for purposes of discussion.
Okay. Supervisor Gaspar, do you want to speak now?
Thank you. I would like to indicate my support for options in our educational system, options for parents and options for teacher. As a mom to 3 kids myself, I certainly know in my own household that all 3 of my kids are quite unique and their needs sometimes are a bit different. Also, as a mother, I have other moms in my friend groups, friend circles, and they have different comfort levels when it comes to a return to school. And I think it's really important at this point in time that we meet people where they're at. There are some teachers that are anxious to get back in the classrooms. There are others that are more hesitant. There are people that have different levels of health, and we need to be respectful and meet people where they're at this point in time. I know there are a number of schools that will be applying for those waivers. I did have a chance to review the state guidance last night, and it sounds as though they've really laid out parameters by which a school could meet all of the guidance and be able to open up for elementary education. At that point in time, I think it's still advisable for those schools to provide options, to provide a track for distance learning to accommodate the needs of families that may have at-risk individuals in the homes. Their kids might be at risk as well. I think there's a rare opportunity to take some of the teachers that aren't appropriate for the in-classroom setting at this point in time and have them manage the population of kids that have to go forward with that distance learning model. I know our school districts are doing everything in their power to offer a menu of opportunities for our kids. I certainly support that. And I think we need to be as flexible as possible during this time. When it comes to our compliance, I do respect our public health officer's desire to continue. We do have to investigate these outbreaks as they come forward. It's been really challenging for our sheriff's deputies to be managing this situation. I watched a video the other day of our deputies having to go in and break up a Little League game. And it was one of the saddest things to see for all parties concerned. I'm certain that it was very shocking for the Little Leaguers to see sheriff's deputies come down to the mound to speak with their coach. And then also very tough for our sheriff's deputies to have to step in for something like that. I think it's inappropriate for our law enforcement to be pulled away from their duties in order to manage this pandemic. And I am supportive of our staff taking on the task of that compliance, I think that's appropriate to do. In terms of expansion for compliance, that's something that I think we need to be really careful about how far we're going to go with the complaints that we're receiving about neighbors who might be walking the dog without a mask. That's something that just gets to a whole new level for me. So I think maintenance of our efforts is important. When we talk about egregious offenses, I want the community to know that by and large, our business community has been very supportive. They've jumped through hurdle after hurdle to do the right thing, to protect the community, to keep their business doors open. Congratulations, San Diego. You've done a really good job in helping us get through this pandemic. The egregious violators we're talking about come down to a handful of people. So we're talking about literally 5 businesses that really have been very bold in saying, no, we have no desire to follow this public health order. But the interesting thing that even in the egregious violation category, those individuals by and large have come into compliance, and perhaps reluctantly so, but they've come into compliance. So that demonstrates to us that the system is working. Whether 211 is the right place to address these calls or whether you have a different system in place is one thing, but I'm not supportive of expanding. Rather, I'm supportive of maintaining our effort without law enforcement, but with the county taking that lead role. So whatever gets us to that point, I'm happy to support as well. So that concludes my preliminary comments. Thank you.
Okay, Supervisor Fletcher.
Yeah, I have a question for Supervisor Desmond. Supervisor Desmond, the guidance that was put out on schools specifically gives local control. The superintendents are supposed to verify that they've met the standards, send it to the public health officer who will give the thumbs up or thumbs down. So I'm just curious what it is we're asking for, given it certainly appears to me that the waiver guidance that came out allows for local control.
It absolutely does. All I'm doing is a message of support of that effort.
Okay, so we're going to amend our effort to just say we're in support of what's happening?
Yeah.
Okay, hard cool. To oppose supporting what's happening. I think the on the enforcement piece, no one has ever suggested that the person walking their dog would ever face enforcement. I think we've been really clear that that's not individuals who make a mistake or forget their mask. That's not what we're talking about. I think the focus on the egregious ones is, and I know Supervisor Cox and I repeatedly make the statements when we do the briefings, that the overwhelming majority of folks are doing right. It is those handful of blatant, willful ones that I think are compromising the ability of the entire region by promoting an unsafe environment. And we have seen in at least one instance that was publicly reported, an outbreak tied to one of those examples of someone who said they were going to defy the orders and remain open anyway. I do think, though, from the enforcement standpoint, if we want to reward the vast majority, the overwhelming majority of San Diegans who are in this together, doing everything right, wearing their face covering, avoiding large indoor settings, then I do think some level of enforcement is appropriate. And law enforcement has been clear they're not going to go out and do this. And so I think that the ability of us to be able to not only do the egregious and outbreaks, but also take into some of those tiers. And I think that the concern I have with just tier one is entities operating that are prohibited under the health order. There are just not that many of those. Those are entities that are required to be closed, that are open, and there simply aren't a large category of those. I think tier two gets into where we could see some real problems with potential outbreaks. And that's entities that are opening, but are clearly not complying with the parameters upon which they're supposed to open. And so I think at a minimum, as a county, we should be moving to tier 3 or tier 2. And then tier 3 is a de minimis. It's one person to just go out and do some proactive work and be out in the community, be of aid and assistance. And so I would prefer, we're happy to see how the board discussion goes. I would prefer us to adopt all 3 tiers. Again, the difference between 2 and 3 is de minimis. But if we don't at least do tier 2, we're missing a huge chunk where we can potentially help folks come into compliance, lower the number of cases, lower the number of outbreaks, and keep more of our businesses open. And so I would rather see us go in that direction, but we'll let the board discussion continue and then see where we land.
Okay, I see no other requests to speak at this point. Let me ask, okay, Supervisor Jacob.
Yeah, I did have my hand up. I wanted to ask a question, then get to the motion, but does the health order allow sport fishing?
This is
Somebody
Tom.
answer that?
Yeah, this is Tom. The health order allows for commercial sport fishing operations to work. When it comes to recreational boating, the health order, as I recall, you could correct me on this moment, is limited to same households being on the boats.
So with sport fishing, then, if you could further amplify the sport fishing, any number of people on a boat at one time, and they don't have to be in one household?
They do not have to be in a household, but they do have to have social distancing, and they have to meet the other requirements of sanitation, masking, and all those. And I think the concept is that you have a operator who is responsible for making sure that that occurs. The concern with recreational boating is if you have more than one household on the boat and you don't have anybody who is really responsible for making sure that all of that occurs, there is a concern that that would be very difficult to enforce social distancing. And you're in a confined area there, so you're likely to have a good chance of spread.
So would we have the discretion? I mean, we all heard from the recreational boating folks that they put together a plan where they would have one person in charge, so that it would be easy to trace, and they'd have their guests and a guest list. So if they put together a plan that would do the same thing as required of the sport fishing industry, what would be wrong with that? And do we have the local discretion in our health order to treat the recreational boating under certain protocols like sport fishing? Do we have the authority to allow that under our local health order?
We would have to check with the state to see whether in their essential business group, whether they would approve that type of activity. Right now, I believe that it would be a less restrictive, and we're not allowed to do less restrictive. We're only allowed to do more restrictive. If the state were to say that that type of activity was allowable with those conditions, then we would be able to do that.
Well, I don't know about the maker of the motion if he'd want to consider that in, but if not in this motion, I think there's a real inconsistency here to where the sport fishing industry is allowed to operate in a way with certain protocols, and non-household people can gather, and then recreational fishing folks cannot, even if they use the same protocol. So there seems to be an inconsistency here, and I think that there's an opportunity to make sure that this inconsistency is corrected. So Jim, I had other couple of questions, so I don't know if you want to clutter up your motion even more and include that as something that our county health officer could work with the recreational fishing, recreational boating industry and see if they can come up with something that could be sent to the governor. I don't know.
I'd be happy to add that.
Okay, I would ask that that be added. Then on the schools thing, as a former school board member, and when we talk about local control, there are elected school board members that make the decisions for their schools, which would include whether or not they feel it's safe to reopen or not. So they know the waiver process is there. I've talked to school folks, and some of them are applying and they want to do that, but they're working with parents and they're working with their labor folks and determining the best way to move forward. So I too want to make sure in your motion, all we're doing is supporting the waiver process that already exists.
Yeah, I realize it's not a lot to it, but I'd like this board to take that position that we do support the waiver process as it exists. It just came out yesterday. And, so I thought it was a good process, and I just wanted, the board to say, yes, we agree with this and we like it.
That's fine. But at the same time, while we support the waiver process, we would defer decision-making to the elected members of each school board. And I think that's very important. Thank you. The last one is on the compliance issue. And I'm looking at, and I don't know if it can be pulled up, but I'm looking at page 6, I think, of the presentation that we were given on compliance, and where it says program component, it says phase 1, gregarious cases, outbreaks, call center, mobile app, already moving forward for implementation. And that's the 1.4 million, 13 staff. But then there's a phase 2. I'm not talking tier 2, I'm talking phase 2 compliant tiers. And number 1 says entity operating is prohibited under the health order. That's another 1.8 million and 22 staff. I think if an entity is operating in violation of the public health order, there it is, just phase 2, number 1, then I think we also should be doing that. And that's as far as I would go with compliance. I think the way the county is proceeding is correct in educating and then warnings, but where you've got a violation of the health order and you've got some public health and safety issues, I definitely think we need to clamp down hard on those. I don't agree with proactive inspections, going out and knocking on doors and whatever. And I think at this point, that's what I would support. So I'm not clear on the motion, whether it includes that phase 1, number 1, or phase 1, phase 2, number 1, or not.
Yes, that was my motion. I don't know if I didn't make it clear enough, but yeah, phase 2, I called it tier 1, but phase 2, number 1 would be the extent of the complaint tiers. And
okay.
and one of the things that I would like to just, are you finished, Diane, or do you have more?
No, that clarifies. Thank you, Supervisor. With that clarification, I'll support the motion.
Okay, and I just wanted to kind of reiterate, we want to prioritize stopping the spread of the virus. If somebody's, somebody's doing haircuts in their garage, but they're wearing masks and they're wearing gloves and they're doing those types of things. I would rather the focus be on the people that are not wearing the masks and not wearing the gloves. And so I guess that encompasses part of, not complying with the safe opening, which is part of 2. But I think that can be done under 1. I mean, we want to stop the spread of the virus is the priority, and making sure that people are adhering to stopping the spread of the virus. So as opposed to cutting hair in their garage and things like that are people want to pay their rent and their bills. But so the motion was just approve what's going on with the state with the waiver process and phase 2 tier 1. And the
Vice Chairman Desmond, can I make a suggestion? I mean, we've got kind of I don't want to say a Christmas tree list, but we got some recommendations that have been provided by staff, and then you and Supervisor Jacob added some other suggestions. I think there's many of those I think probably all of us could support. And I was wondering if we could maybe vote on the recommendation to receive the update in the COVID-19 response, to ratify all the actions taken in response, to ask the state for guidance on recreational boating, having a local option, and to reiterate our support for school reopening waiver process. Vote on those 4 first. I haven't heard anybody raise any concerns about that. And then hit the last couple of items that you brought up, because I think there'll be a little more discussion and maybe.
So everything except the compliance program.
Yeah, and I assume the engaging a third-party statistician, that's something we're putting off till
Chairman,
next
I
month?
just request to the motion maker that, or on this motion, if we could include just a panel discussion at the September COVID update that includes the other areas, that more holistic view of the health of our region as suggested by the CAO in the letter.
Okay, as opposed to actually hiring a statistician.
Correct.
Okay, I mean, we can include that, and then we can have a discussion on the compliance component. Would that be acceptable to the maker of the motion in the second?
Absolutely. Absolutely, Mr. Chair. Thanks for cleaning it up.
Okay. Was that okay, Supervisor Gaspar?
Yes, thank you, Chairman.
Okay. Yeah, is there any further discussion on those 5 recommendations? Everybody has an understanding what we're voting on? Well, could the clerk go ahead and call the roll?
Thank you. Chairman Cox?
Aye.
Supervisor Jacob?
Aye.
Supervisor Gaspar?
Aye.
Supervisor Fletcher?
Aye.
Vice Chairman Desmond?
Aye.
Chairman Cox, that motion passes unanimously with all board members being present and voting aye.
Okay, and then on the last one on the health order compliance, I mean, Supervisor Fletcher has made reference to the fact that, you know, practically at every one of our media briefings, we acknowledge the fact that the vast majority of businesses and people are really in compliance, but we do have some egregious situations that we've all talked about and seen in the media. And clearly we have to have some way to deal with those egregious violations. So phase 1, I think, seems to be, you know, a given. In regards to phase 2, again, I don't think we want to take an approach of beating up on businesses that are having a hard enough time as it is now, but I think we do want to certainly do what we can to encourage and to assist in allowing those businesses that are trying to comply by the public health order to, you know what it is they have to do in order to comply. So I think, you know, 2.1 is phase 2.1, which is entity operating is prohibited under the health order. We want to let them know that that's the case. If we get into the other phases of components of phase 2, if they're not fully compliant with the safe reopening plan, I really think that's a role that we should be taking on as a public health office for the county of San Diego. If they're not fully compliant, then let's figure out what we can do to help them comply. And I think that's what the intent is of that particular recommendation. And then, you know, obviously the proactive inspections, it's pretty de minimis, 120,000 one staff person. And in fact, I think that's really going to be done more on the basis of, as our existing Department of Environmental Health people go out and do restaurant inspections, as cities do their fire safety inspections. I mean, again, this is kind of a partnership that we've been working towards with the cities, excuse me, to get them more directly involved and assisting us to work with businesses to get them to comply. So I would really like to see us include both phase 1 and phase 2. And that'll be my comment.
Quick, is that a motion, Mr. Chair?
I would make that as a motion.
Okay, I would second that motion. And I just want to point out that the difference between 1 and 2, 1 is entities that are ordered to be closed, and there aren't a huge number of those. We have most things open, but those are things that are just clearly shouldn't be operating. Tier 2 is again, it's not folks that are trying to make a good faith effort, but if you have an employer who say is allowed under the order to be open, but under restrictions, and they have 500 people in one single room with no face coverings and no physical distancing, if we don't have the ability to go out and engage with those folks, then we have no mechanism to go and enforce those. And that is a tier and category where we do see a significant number of complaints, some of which come from employers who are in situations and other type settings. And so I think having that option to be able to engage with those folks who are clearly not complying with the safe reopening plan, but are allowed under the public health order to be open is a tool that we need. Again, the overwhelming majority of folks are doing it right, and will never encounter or engage any of these types of folks. But in order to truly honor the folks that are doing it right, I do think that there has to be some ability to engage with folks who are not doing it right. And again, I don't think any of this is a heavy-handed approach. These are not SWAT teams or Navy SEALs. These are code compliance county public health folks that are going out to engage. And so I think having more of this as we go forward is a useful tool in our ability to most effectively respond. And so I'd be happy to second the motion.
Thank you, Supervisor. Supervisor Gaspar?
I would just wanted to ask staff a question about that. That sounds, what the supervisor described is an egregious situation. So it is my understanding that we do have the ability to look into cases like that, even if we move forward in phase one. If we had a complaint or repeat complaints of a business who's not in compliance like that, we would investigate that. That's what we're doing today. That's my understanding of our phase one that we're already in. So can you clarify for me, if we were to move forward with phase one, do we have the ability to explore a egregious case complaint or not?
Through the chair, Supervisor, the answer is yes. If we receive complaints and we see a business that is allowed to operate, meaning they are not prohibited under the health order from operating, yet we receive a number of complaints that they don't consistently follow their safe reopening plan, we would look into that and look at it as, could it be an egregious case, and at least start by investigating it as part of looking at egregious cases.
Thank you. In that case, I'll make a substitute motion to adopt phase one, also in phase two complaint tiers, item number 1.
I got a question.
I think just from a procedural standpoint, I really think that was the remaining motion that was on the floor. Excuse me, by Supervisor Desmond. And what I made was a substitute motion to approve the both phase one and phase two. Maybe the county council can roll on that.
I'm sorry, I'm not following. My understanding is that you made the motion to have phase one and phase two and options 1 and 2 in phase two.
Yeah, actually, just to interrupt you, I think Supervisor Desmond had made an all-inclusive motion, which he was very agreeable to allow us to vote on everything except the compliance component. And I believe his motion was to include phase one and then phase two, item 1. My substitute motion was to go ahead and approve both all of phase one and phase two, which was seconded by Supervisor Fletcher. And now, Supervisor
It may be
Gaspar.
my misunderstanding. Then it was my misunderstanding if that's the case, because I thought we set aside the compliance portion for discussion. I didn't know that it included any level of the compliance.
Well, I mean, I don't.
Bifurcated motion, then that's fine. If that was a bifurcated motion, the first one, then you are correct, Supervisor, Chairman Cox.
Yeah, I think, we'll get to probably the same point, one way or another, depending on how the votes turn out. But the motion on the floor right now is to go ahead and fold the substitute motion to include all of phase one and phase two. If that goes down, then we'll go back to Supervisor or Vice Chairman Desmond's motion, which is to approve phase one and phase two, but only item number 1, which is entity operating is prohibited under the health order as far as the complaint tier. Does that make sense, or am I confusing things?
If I could say, Wayne, that makes sense. I was wondering if my motion just disappeared or not, but it is still the original motion. And I think with phase one, we don't really need. I mean, phase two is going to be covered. If somebody's not fully compliant with the safe reopening plan, and we get enough phone calls on it, and it's egregious. I mean, if somebody's just not, if there's one person there not wearing a mask in a store, I don't think we need to have 2.5 more staff members and the extra money. If something's egregious or it calls itself to be egregious, I think number 2 is going to be complied with under phase one, and we can be able to do it with the staff that we are supplying under phase one. Under tier 1, I guess, under phase 2. So I'm not going to support I'm going to hold to the just supporting tier 1, and I believe all of those things that you're concerned about would be worked out. Thank you.
Okay, so the motion on the floor right now is to approve all of phase 1 and all of phase 2. If that is voted down, then we will go to Supervisor Desmond's motion, which is to include all of phase 1 and then component 1 of phase 2. Supervisor Jacob?
Thank you, Mr. Chairman. I want to talk about the money attached to this, because we've got the 1.4 million now. I want clarification on phase 1, the 1.4 million with the 13 staff indicated they're already doing it. Has that money been allocated? Could I get a response?
Can we get the CAO to respond to that, please?
Supervisor, yes, that money, we have the 175 million in the public health response. For egregious, we were doing those within that. The augmentation of that, we believe we can still cover within that 175 million.
Okay, that's not where I'm going with this. Is it a 3-vote item or a 4-vote item? Are we allocating the 1.8 million? And then if we move forward on the other money that's outlined here?
You are not allocating or appropriating money for phase 1. That has already been done through the 175 million. What you are allocating and appropriating, which is a 4-vote item, is the phase 2, what level of complaints you're interested in. Complaint level 1, tier 1, tier 2, and tier 3. So
okay.
The allocation in tier 1, or excuse me, in phase 1, we are already doing as an enforcement for egregious and the outbreaks. And we are enhancing that, but we have the allocation and appropriation for that within the $175 million.
So are you asking us to approve then phase 1 or not?
We are asking you on phase 2.
Phase 2 only?
That is correct, to determine what level of enforcement do you want on the complaints that we're receiving.
Okay, and that's a 4-vote item. And Mr. Chairman, I think that's really important. So if we go beyond phase 1, and we're back page 6 again, on item 1, which I support, and that's $1.8 million that we would be allocating today. So I think it's really important at the very least that we move forward with phase 2, number 1. I think that the question Supervisor Gaspar asked about, would staff be following up on number 2, an entity that's not fully complying with their safe reopening plan? Staff said absolutely if they get additional complaints. So I see no reason to spend the additional money. I think we can see how this works. There's a message sent. It was in the front page of today's paper. And I think if the county clamps down and focuses on those, particularly in phase 1, and then phase 2, number 1, that it will send a strong message. Yes, we want a partnership. We want to work together, and we want compliance with each of our businesses. I think, I mean, my feeling, and I've said it before, ultimately, so I'm not going to vote on the substitute motion. I'll vote no on that. And I know you want to get this done, get it out of the way and get moving. But I have to say this, that I think ultimately what we're doing here is we are separating out the problem businesses within a sector. And I would hope at some point that we can work on some kind of a plan and work with the governor's office in order to refine the governor's order in a sector. Let's take restaurants. We've got hundreds and hundreds of restaurants throughout the county. We don't have that many that are problems. So why punish the whole sector, every restaurant, by saying, hey, you can't do indoor dining, you got to do it outdoors because of a few. So I would hope at the very least, maybe we could work in developing a pilot project to where we could go the next step, because what we're doing today really is focusing on the bad actors, those that are not complying, and separate them out from the rest and allow the rest to move forward as they were before. So I feel compelled to say that, and I'll say it over and over, but I would hope at some point that maybe the staff could look at a pilot program of some kind and work with the industry, not just restaurants, but the other sectors, whether it's salons or whatever. So thank you for indulging me, and I'll vote no on the substitute motion.
I would just point out that in the staff report on page 15, they talked about that there's still $9.2 million that is available in the CARES Act and other funding sources that we've received from the state and federal government. And if we did approve the motion that's on the floor, which would take a 4/5 vote, the additional cost beyond phase 1 would be a total of $3,920,000. And obviously that's a big number, but that's kind of what we're voting on. Supervisor Gaspar, your hand is still up there. Is that from the last time or do you have additional comments?
It's still from the last time. I just think that we need to be very careful about our CARES Act funding at this time. I think we'll be discussing in the next item the needs as well out in the community. I want to point to the popularity of the small business stimulus program. To date, we've received over 5,000 applications into that program. I think it's over $400 million requested from our small business community. And this is our local workforce. These are our jobs, the people's ability to put food on the table. So it's no surprise that food insecurity is now a big issue. So I agree with Supervisor Jacob that I think it's important to take the time to see how this goes. If we continue to have situations, we have to be responsive to that in the county. But I think this is a good preliminary step, and our resources are limited. So let's see how it goes and figure out every possible way to provide the relief needed back out in our community. And a couple $1 million would go a long way back into that business stimulus program as well if we end up having extra funds. Thanks.
Thank you, Supervisor. Thank you. Okay, then just to be clear, we are voting on a substitute motion, which would be to fully fund phase 1 and phase 2. The phase 2 component of that package will take a 4/5 vote. And so if there's no further discussion, I would ask the clerk, please call the roll.
Thank you, Mr. Chairman. Chairman Cox, your vote?
Aye.
Supervisor Jacob?
No.
Supervisor Gaspar?
No.
Supervisor Fletcher?
Aye.
Vice Chairman Desmond?
No.
Okay, now I'm sorry. Go ahead, Mr. Potter.
Thank you, Chairman Cox. The motion fails with Supervisor Fletcher and Chairman Cox voting aye, all other supervisors being present and voting no.
Okay, the motion before us now is Supervisor Desmond's, Vice Chairman Desmond's original motion, which included to go ahead and approve phase 1 and tier 1 of phase 2, which would be an additional $1.8 million cost. And that will take a 4/5 vote. If there's no further discussion on that motion, would the clerk please go ahead and call the roll?
Thank you. Chairman Cox?
Aye.
Supervisor Jacob?
Aye.
Supervisor Gaspar?
Aye.
Supervisor Fletcher?
Aye.
Vice Chairman Desmond?
Aye.
Chairman Cox, that motion passes unanimously with all board members being present and voting aye.
Very good. Our last action item on today's agenda is item number 3. This is to approve a proposal for the allocation of $48.8 million in CARES Act funding, establish appropriations to support proposal allocations, and receive an update on the feasibility of funding for testing at the United States-Mexico border. Does staff have a brief presentation on this?
Yes, Chairman. This is Andy Pease.
Mr. Pease, before you begin, I would like to note for members of the public that have requested to speak on this item, please dial into the conference line now using the instructions that were provided to you. You will be muted until it is your turn to speak.
I'm good to go. Thank you. Good to be back in front of you so soon. As discussed earlier today, the County of San Diego has $48.8 million of available CARES Act funding that has yet to be allocated for any specific use. On July 7th, your board directed the CAO to return today with a proposal in the use of these funds, and your board also requested the determination on the feasibility of funding for COVID-19 testing at the United States-Mexico border. Today's presentation will cover these requests. In development of the proposed use of the $48.8 million, on July 7th, your board offered specific suggestions. You suggested using $25 million of the CARES Act for child care providers, for funding elements such as staffing, supplies, mortgage, and rental assistance. Your board suggested $18.8 million for food services that included programs that engage restaurants. And you suggested $5 million for public health testing, tracing, and treatment strategies specifically for San Diego County K-12 schools. Today's recommendations follow those amounts. To begin with, $25 million is recommended to be allocated and appropriated toward a child care provider grant program for licensed and license-exempt child care providers struggling with financial hardships due to the COVID emergency, and to partner with the San Diego Foundation, the YMCA of San Diego County, and Child Development Associates to administer the program. The funding would be available via a grant process to approximately 4,400 child care providers. These grants would be distributed across the county with a flat rate based on size to licensed family child care providers and a per-child rate for licensed centers and for licensed exempt centers not government contracted, regardless of location. Large and small providers will be eligible and will receive these grants, from family-run to larger organizations such as the Boys and Girls Clubs. In partnering with the San Diego Foundation, they will leverage an additional $10 million towards similar efforts above the $25 million over the next several years, with the first $1 million of those funds expected to be awarded this calendar year. As stated, eligible uses could be rent and mortgage payments, PPE, staffing, supplies, business resilience efforts, and capital improvement. Today's action also recommends allocating and appropriating $18.8 million of CARES Act toward a variety of food programs. $6.8 million to double the Great Plates Delivered program to approximately 4,000 recipients a month, as well as increasing restaurant participation. This program is a state program, largely funded by FEMA, and is set to end in mid-September. If FEMA continues the program through December, we could sustain the program for that period of time, and we would have additional funding left over to allocate to the other food programs. If FEMA ends the funding before December, the county could sustain the program until the CARES Act funding is exhausted. $5 million is to stand up Great Plates 2, or what we call Great Plates 2 program. This program would basically expand eligibility beyond the Great Plates Delivered program to allow more seniors to receive meals and to include disabled individuals who are impacted by COVID-19. It would offer fewer meals a week as compared to the Great Plates Delivered program, and we estimate we could serve approximately 1,500 to 2,000 folks, but they'd receive fewer meals in a given week. We could run the program through December. $3.5 million is to support food banks, which provide vital services to individuals and families who face food insecurity, poverty, and financial challenges tied to the COVID-19 emergency. We recommend allocating $700,000 a month through December to be distributed between the San Diego Food Bank and Feeding San Diego, with priority focus for seniors and individuals with disabilities, especially in hard-to-reach areas. And then $3.5 million for economic stimulus for restaurants. Due to the significant financial impact of COVID-19 on the restaurant industry, it is proposed to supplement the existing San Diego County Small Business Stimulus Program that your board established on July 7th and add additional $3.5 million of CARES Act funding dedicated to restaurants using the same mechanism as the existing program. $700,000 would be available for each supervisorial district. Your board requested consideration on the allocation of $5 million for public health testing, tracing, and treatment strategies, specifically for the San Diego County K-12 schools. As you are aware, and as was discussed earlier, our schools are currently closed for in-person instruction. There is the waiver element now to consider. With the schools currently closed, we are not recommending adding the appropriations at this time, but we do recommend that the $5 million of the CARES Act funds be set aside to support these efforts. And county staff would be working with the San Diego Office of Education, with school districts, and even our local universities to develop and pursue innovative, cutting-edge strategies and best practices to support testing, tracing, and treatment as it relates to the schools. At the July 7th board hearing, you also requested the feasibility of funding for testing at the border. This obviously is an allowable CARES Act cost. We currently have between 20 and 30 testing locations in any given week across the county. And the average monthly cost to run a site is between a couple $100,000 to $1 million per month, depending on the scope and size of that site. Our closest testing site to the border at this point in time is our walk-in site, which we run in partnership with the state at the San Ysidro Civic Center, which is approximately 2 miles from the United States-Mexico border. That site's open Tuesday through Saturday and has the capacity to test around 130 or so individuals a day. In addition, in the next couple of weeks, we will be piloting a no appointment walk-up testing site at the border. The location is at the Ped East pedestrian crossing at the San Ysidro port of entry. This entry is for essential workers and U.S. citizens coming into the United States from Mexico, and our pilot will focus on essential workers, but we typically do not turn anyone away, and we expect to open the site as early as August 12th. And finally, just for reference, in May, the University of California, San Diego Health submitted a proposal to the U.S. Department of Homeland Security on a risk mitigation and testing strategy for COVID testing screening at the border. And their estimated costs was between $3.8 to $18 million a month, depending on the scope of their project. It was very robust. It included screening for voluntary testing at 3 points of entry, had a work site safety program to provide technical support for companies based on the latest guidelines and tailored to the workplace. So in closing, today's board items include 9 recommendations. Recommendations 1 through 3 are to allocate the $48.8 million of CARES Act funding. So you would say yes, $25 million for child care provider program, $18.8 for food programs, and $5 million for T3 efforts. Recommendations 4 through 8 establish the appropriations for the various food programs and the child care grant program, as well as enter into agreements with the San Diego Food Bank and Feeding San Diego for the provision of food bank services. And finally, recommendation 9 is to enter into an agreement with the San Diego Foundation, the YMCA of San Diego, and the Child Development Associates to implement the child care grant program. This concludes our presentation, subject to any questions.
Okay, we do have a number of speakers on this. Are there any questions of staff before we go to the speakers? Seeing none, I understand we have a group presentation, but only 2 of the 3 speakers are available right now. Let's go to the individual speakers, and if that third speaker in the group presentation does not come online before the end of the individuals, the remaining 2 will be allocated 2 minutes. Otherwise, they'll get 10 minutes for the group presentation.
Thank you, Mr. Chairman. I'll note for the record that we received 13 e-comments on this item. We have 11 callers on the line to address the board. That includes the 2 individuals for the group presentation. We're waiting on the 3rd individual. We'll be calling speakers by the last 4 digits of their phone number. You'll hear a notification that your call has been unmuted. Each caller will be asked to state their name for the record, and you will have 2 minutes to address the board. You'll hear this sound when your time is up, so please conclude your comments at that time. And I'd remind the public speakers that they should mute their TV or live video stream before they begin speaking. Thank you.
Thank you. Our first caller is 1639.
My name is Darren Solomon. I'm the owner of Kid Ventures, and we're a San Diego homegrown, family-run business operating 3 preschools and early childhood centers in the county. I want to first thank you supervisors and members for giving me the opportunity to briefly comment on my strong support of allocating $25 million of CARES Act funding towards supporting child care providers with the additional $10 million through San Diego Foundation. Child care is a critical part of San Diego's economic recovery, as businesses can't reopen without the availability of quality care for their workforce. For over 15 years, my wife and I have dedicated our time, our energy, and any money we have into helping families with young children through our business, Kid Ventures. We provide early childhood education and child care services to toddlers and preschool-age children. COVID has been devastating to our business, and I know from working closely with other child care and preschool providers, we are all feeling the same pain. While we've been able to stay open in a limited capacity for essential workers, we have seen our enrollment dwindle since the start of shutdowns in March, and now reduce even lower with the recent spikes. And also the fact that school-age children will not be returning to classrooms in the fall because of many of the families who have both preschool-age children and elementary-age children, for the most part, are not going to send their preschoolers to school when their other children have to stay home. Direct support through funding like what is being proposed today from the CARES Act to help with all the new requirements we must adhere to in order to protect our children and teachers is not only important, it's also a good start. To give you an idea, our preschools, our monthly operating costs average $165,000 a month, which covers things like payroll for teachers and support, rent, utility, insurance, and curriculums. Since the start of COVID, that equals about over $700,000 of expenses that we have to figure out how to reduce or defer, but for the most part, to pay for these expenses. So with our enrollment dropping, we desperately need this type of funding, or otherwise there will be a problem with schools not being open once everyone's back online. Thank you again.
Thank you. Our next speaker is 2441.
Hello, my name is Daniel Gunder. I represent Jiminy Kids. We've been serving the community since 1987. I'm also a husband and a father of 5 children. Our business has been operating at a loss since March. Since reopening in June, though we are grateful to be open, following the new protocol is expensive, which continues the deficit. If child activity centers cease to exist, our children will not have a productive outlets, families won't have daycare. If we want our children to be able to focus during distance learning, if we want to limit the disciplinary issues, an emotional and physical outlet is crucial. Now, our children have suffered the most during this time. We want our kids to emerge with post-traumatic growth. We need private entities like ours to exist in 3, 6 months and beyond. Our communities need a place for those with special needs, daycare, day camps, and youth sports for all ages and abilities. The long-term psychological effects of COVID as it relates to our children is a scary thought without private entities like ours providing support for families. Now, we are a gymnastics facility and we provide day camps and exercise for our kiddos. We hope to continue serving San Diego County for the next 33 years. And I would like to request that you also consider a future fund for youth sports or include them in particular, especially as we enter the virtual school year. Thank you.
Thank you. Our next speaker is 3573.
Hi, my name is Ron Lacey, and I'm calling on behalf of the Lulu's Restaurant and Grill. I want to take the time to thank Supervisor Cox and particularly the Honorable Diane Jacobs for allowing me to speak. I'm calling because Lulu's Market is hoping to get into the Great Plates initiative. We have a 4,000 square foot restaurant, and we've been serving the community for the last 3 years. Unfortunately, due to COVID-19, we've had to reduce operations because, of course, the lack of funding that our clients have had. We're asking that we get a chance to help. We can provide up to at least 1,000 meals a day, breakfast, lunch, and dinner. I've been part of the management for the restaurant, and I'm looking for some assistance to get the things off the ground. We have been doing really well, like I said, prior to COVID-19. We are looking forward to helping the county with this initiative to live well. We feel as if we can adequately provide very healthy meals. We can deliver these meals. And I personally have been in the public sector for quite some time, working for the Honorable late George Stevens and late Charles Lewis, as well as a member of Jerry Sanders' staff when he was mayor of the city of San Diego. So I've worked with the public in many different capacities, and we're looking forward this go round to actually helping out with the meals. And I'm truly supportive of the initiative, and we just look forward to helping out. Thank you.
Oh, thank you. Our next speaker is 4516.
Good afternoon. My name is. Many people that is so well run. Florida's a very well run state. Low taxes, low everything. They've got a great.
4516. If you have a TV on in the background, you may want to mute that. Four, 516. We'll try coming back to you. 6435.
Good afternoon, Chairman Cox and members of the board. Chris Duggan with the California Restaurant Association, speaking in support of item 3, specifically the appropriations of the $6.8 million to expand Great Plates. It's been a very beneficial program for both the elderly and the underserved in our community, and we have loved working with our members in getting that help out there. So we're in strong support of expanding Great Plates, also introducing Great Plates 2.0, and lastly, $3.5 million being allocated for small business restaurant relief. Before I jump into my comments, just want to thank each of you on the board for your continued support and commitment to San Diego's restaurant industry. It has been tough for the past few months here for the industry, and each of you have played an integral part in helping our restaurants during this unprecedented time, so thank you. So today, the San Diego restaurant industry is one of the largest contributors to our local economy. We have over 8,000 restaurants employing approximately 126,000 residents. Unfortunately, as you've all witnessed, the past few months have been very tough. We've witnessed some restaurants having to make the heart-wrenching decision to close their doors for good. The latest closure for restaurant dining rooms was a devastating blow to the industry, who is already struggling. As expected, San Diego restaurants, determined to succeed and apply the never give up mentality, pivoted quickly by going outdoors and expanding their dining in parking lots, sidewalks, pedestrian plazas, and streets. And while this has been very helpful, we must be honest with ourselves. This, unfortunately, is a stopgap measure. We must continue coming together collaboratively, both local, state, and federal, and coming up with programs, what you have before you today. So we thank you for this, and we look forward to your support in this item. Thank you very much.
Thank you. Our next caller is 7244.
Good afternoon. My name is Lindsay Wade, and I'm calling today on behalf of the Hospital Association of San Diego and Imperial Counties. Before I continue, I want to first thank the Board of Supervisors for your incredible partnership with hospitals and health systems during these unprecedented times. We know that you stand ready to support our regional healthcare systems whenever you can. We strongly support the proposal to allocate $25 million of the county's CARE Act dollars to child care providers. Hospitals and health systems in San Diego County provide employment to approximately 70,000 people, and multiple HR directors from our health systems informed us just last week that the child care needs of their employees are currently not being met. Add to this that most schools will not be holding in-person classes this fall, and it is clear that the need for school-age child care providers is more critical than ever. Hospital staff and physicians are increasingly concerned about how to find child care for their school-age children that allows for some social interaction with other children and facilitates their child's distance learning. Additional funding for providers who serve school-age children and have the experience needed to keep children safe and support distance learning is absolutely essential. Hospital staff and physicians are also struggling to find child care providers for their young children. Availability is very limited because child care providers are struggling to keep their doors open. They must implement costly new requirements necessary to ensure safe learning environments, while simultaneously reducing the number of children they can serve. These providers need funding to ensure they can continue to operate. The availability of childcare for children of all ages is critical to ensuring our hospitals' ongoing ability to meet the challenges of the COVID-19 pandemic. Thank you again for recognizing the urgent need to keep childcare providers operational to safely support children and families in our region. Thank you.
Thank you. Our next caller is 7554.
Good afternoon, and thank you to the board for the opportunity to speak. My name is Erin Hogeboom, and I'm director of San Diego for Every Child. We are a countywide coalition of passionate organizations and San Diegans working to cut the experience of child poverty across our county. This is an issue for which access to quality child care and early education is paramount. As a coalition, we are grateful for your decision on July 7th to invest $25 million in CARES Act funding to support child care in our region. I'm calling today to ask that you reassert this investment with a yes vote on the final approval of this spending. Our local economy cannot recover or thrive without a well-supported child care ecosystem. Child care providers make it possible for parents of both young and school-age children to return to work, while they also support the healthy physical, social, and cognitive development of children and youth. It is our responsibility as a community to ensure that our child care providers can continue to operate in a manner which ensures both their safety and the safety of the families they serve. And your vote in the affirmative will help to do that. Additionally, we would like to share our support for allocating now the $5 million for public health testing, tracing, and treatment services for K-12 schools so that we can be prepared, as we know that this will be a critical preventative measure for keeping our children and their families healthy and safe at the prospect of opening schools. Thank you again for your consideration on these urgent topics.
Thank you. We have one member of the group on the call right now. It's 9896. Are other members of the group speaking, or would you like to go ahead and give your testimony now as an individual?
I would like to go ahead.
Okay, thank you. You'll have 2 minutes.
Thank you. Thank you, Chairman Cox and members of the board. Good afternoon. My name is Miriam Algorre. I'm a family child care provider. I'm a CCPU member, and I'm also a part of the Chicano Federation Infant and Toddler program network. And I would like to share with you the story of one of my young students. She's 6 years old. Her mother is an essential worker. She's a pharmacist. And I have been caring for this child since she was 3 years old. When she started in her care, one of her goals was for her to grow and for us to provide the tools so she could thrive in a proper environment and she could cultivate her problem-solving skills, which are the tools any individual must possess to get ahead in life. As time went by and we continued to work with the student, we saw so many and creative ways that she would tackle a task, she would find solutions to problems, and she gathered the tools she needed to successfully reach her goals. She learned that she must identify the problem, but not to focus on it. Instead, she should focus on finding ways, tools to tackle that problem, that situation, and for that, she needed support. We observed these until the health crisis arose. She's now a first grader who has faced a loss during this pandemic. A week ago, she started distance learning, and as I sat by her side supporting her while logging in to work on her school assignments, I noticed a regression instead of academic progress. I saw her focusing on her math problems instead of the myriad ways to tackle them. I saw this young student I care so much about lacking the confidence to find solution. And I knew then what I've known as for a long time as an early childhood educator. It is my duty to support the student so she can relearn that we must not focus on the situation or the problem, but instead we must focus on finding creative ways to solve them. So my duty as her secondary caregiver is to support her so she can continue to thrive and succeed on her academic endeavors and receive the support she needs as she faces her loss. So today I'm here to offer solutions. I have seen what the problem is, but we have solutions which I cannot implement on my own. I know that we need broadband.
Ma'am, your time is up.
To
summarize your comments, please.
Okay. So allocating the $25 million CARES Act funding into the child care sector would give us providers the tools that we need to support the students on their academic endeavors as proper broadband, tutors, and whatever other resources they need so they can thrive. I urge each one of the members of the board to vote in favor of allocating those $25 million so child care providers can get the resources and materials needed to solve the situation we're facing. Thank you for your time.
Our next speaker is 1678.
Can I help me, please, with translations?
Yes.
Si alguien me puede ayudar a trasladar, por favor, el inglés, español-inglés. Mi nombre, ¿ya?
Sí, ya puede comenzar.
Ok. Mi nombre es María Deyanira Silva Aldana. Soy proveedora hace 7 años de Chicano Federation. Vengo trabajando con ellos de la mano. Venimos cubriendo la labor que escuelas y algunos centros nos han delegado debido a la pandemia. En mi experiencia, los apoyos más visibles han sido Chicano Federation y pues obviamente YMCA y CDA y los programas de gobierno que nos han apoyado. Sin embargo, pues ha sido una situación muy difícil que hemos venido cruzando, ya que en realidad pues venimos cubriendo todo lo que en las escuelas y todos los centros tuvieron que cerrar por seguridad y por la seguridad de los niños. Sin embargo, no podemos dejar de lado que nosotras las proveedoras de cuidado infantil estamos atendiendo esta necesidad, estamos de frente a este trabajo. Inicialmente no teníamos ni tapabocas ni elementos básicos para nuestro cuidado pues contra la pandemia. Sin embargo, a medida que han pasado los meses y el tiempo, hemos podido encontrar algunos elementos para cuidarnos y protegernos. Ha sido una situación muy difícil, incluyendo no encontrar los alimentos para el cuidado y para la comida y incluso hasta para la limpieza y para la comida. Ya, sin embargo, pues a medida que ha pasado el tiempo nos hemos proveído de estos elementos. Quiero resaltar que durante este tiempo tan difícil, Chicano Federation nos ha respaldado, nos ha ayudado y nos sentimos muy agradecidas con ellos porque nos han buscado la manera siempre de tratar de que nosotras podamos continuar. hemos venido no solo cubriendo las escuelas y centros, sino también tratando de ayudar a las familias que están con trabajos esenciales, como en mi caso tengo padres de familia que están trabajando con el Border Patrol, que están cuidando nuestra frontera, otras familias que las tengo, madres que están trabajando en cárceles, que ellas están pues custodiando las personas.
La voy a interrumpir para traducirle, porque si no. Me dijo que su nombre es María Laida Silva.
María de Yanira Silva. De Yanira.
Gracias. My name is Maria de Yanira Silva. I have been working with the Chicano Federation for years during this pandemic. They have been some of our biggest supporters between the Chicano Federation and the YMCA supporting the child care services workers. It has been a difficult situation given that schools and child care centers have been closed. We have, however, faced the difficulties face first, and even though initially we didn't have any PPE to take care of some of us, over the months we have been able to find some. It has also been difficult for us to be able to find the things that we need for our centers, such as the correct foods or the correct cleaning supplies. And as time goes by, we have been able to find those little by little, but I really want to highlight how the Chicano Federation has supported us and helped us. And we are extremely grateful so that we can continue to try to help all the essential workers, including people that we care for, children of Border Patrol agents, and that's where I stopped her. So, señora, puede continuar.
Ok, entonces pedimos que por favor nos sigan apoyando porque esta situación, nosotras estamos trabajando, estamos poniendo toda la fuerza y todo el empeño a que la economía y a que nuestras familias puedan seguir trabajando y puedan seguir ofreciendo su trabajo donde sea que estén y cuidando el país, así como lo están haciendo como las familias que tenemos acá, que vivimos pues prácticamente en el borde fronterizo acá entre San Diego y Tijuana.
Okay, so we ask that you please continue to support us as we continue to work to support the economy and the families of all the people that are working here in the San Diego region, especially between San Diego and Tijuana. Thank you.
Thank you. Our next caller is 4902.
Hello, my name is Shantae Brown, and I'm a child care provider of 22 years. We as providers need the child care stipend to be approved to help child care providers plan and prepare our facilities to aid and support children and their families by having sufficient internet to cover all the Chromebooks we will so serve. And also to make sure we have PPE supplies to keep everyone safe. We will also need to ensure we can provide professional sanitation in our facilities. In addition to keeping everyone safe, we need to ensure we can hire extra staff to be there to help our children with schoolwork, along with the daily needs in our facilities. If we can have this funding, we can be of assistance in maintaining that children are learning and will not fall behind in their academics and will be on track when school reopens. Thank you for your time and thank you for hearing our voices.
Thank you. Our next caller is 8495.
Hello, my name is Rahma Abdi. I'm a child care provider and also a proud member of CCPU. I'm calling in support of the $25 million CARE Act funding to help the child care providers to survive COVID crisis. I encourage you to vote yes for final approval. And thank you for your time. Please vote yes. Thank you.
Thank you. And that concludes public testimony on this item, Chairman Cox.
Very good. Once again, we thank everybody for their comments on this item. We'll now proceed into board discussion. Do one of my colleagues want to jump out there first?
Oh, Mr. Chairman, I would suggest I suggest you take these items one at a time.
Okay, we could do that. The first item is the proposal to allocate $25 million of CARES Act funds to support child care providers. Is there a motion to approve that?
So moved.
Okay, and a second?
Second.
I'll second. Any discussion? Okay, seeing none, we have a motion by Supervisor Fletcher, seconded by myself, to approve the 25 million of CARES Act funds to support childcare providers. Would the clerk please call the roll?
Thank you. Chairman Cox?
Aye.
Supervisor Jacob?
Aye.
Supervisor Gaspar?
Aye.
Supervisor Fletcher?
Fletcher, aye.
Vice Chairman Desmond?
Aye.
Chairman Cox, the motion passes unanimously with all board members being present and voting aye.
Very good. The next item is 18 million of CARES Act funds for food services.
Mr. Chairman, may I, since I had brought this up last time at the last board meeting, in a moment, I'd like to ask Kim Gallo, who's head of our Aging and Independent Services, and she has been heading up this Great Plates program, to provide some information to the board. But I pulled out some statistics focusing on seniors, and I'm sure the board remembers that the referral back to staff was to come back with a plan that helped restaurants and helped seniors, and not just seniors with food, but also the home checks. We have 481,000 seniors over the age of 65, 203,000 seniors over the age of 75. The highest concentration of seniors in our county is in Oceanside, Carlsbad, Escondido, Kearney Mesa, and Central San Diego. 9.4%, almost 20% of all elders 65 and over in San Diego County do not have enough income to meet their basic needs. Over 63,000 seniors are struggling to make ends meet, and 47% have disabilities. And 120,000, almost half of those over the age of 75, live alone. So seniors make up nearly 88% of the COVID deaths also. And so it's necessary that they isolate from home, at home, because they are amongst the most vulnerable. So that's why I so much support the Great Plates program and the plan that staff has brought forward. I think it's a fair plan in terms of extending the Great Plates program and also helping our seniors, and particularly the home check. So Kim, if you're on the line, which I think you are, if you could comment on what you have seen in terms of not just the food that's being provided to the seniors, but also the home checks and the home delivery service. Is she there?
Yes, sorry.
Okay.
Okay, good afternoon. I think one of the great things that we've seen with Great Plates is that in addition to providing necessary meals to our seniors who are at home due to COVID, is also that we know when somebody has their eyes on the senior when they go there, that they're ensuring that they're doing okay. So it's also a form of a wellness check for many of our seniors who live in rural, unincorporated, and also don't have any family nearby that can stop in to check on them. So I think one of the unique parts with many of our meal programs is that part that you have another set of eyes on the seniors in our area. So with Great Plates, we've had wonderful success stories from one senior who wrote into us saying that it was the first time in the last 10 years that she had gained 5 pounds, which seems, not as important to some people, but for those who are struggling already, this was great. We also have had family members write in to say how wonderful it is because they reside out of town and are not able to check on their family members. So just knowing that there is somebody that each day is stopping by to bring the food to the senior, that they know that they're being looked after. So I don't know if there's any other questions that you have, but those are just some of the things that we're seeing through this program.
Kim, you had shared with me about at least one incident where the home check, as a result of the food delivery, brought resources to a senior that had some other needs other than food.
Yes, we've had a lot of those stories where when they're coming by, they also have said that they need additional help, whether it's in-home support services. We've actually been able to sign some people up for having a caregiver come into the home, as well as working with our Alzheimer's and dementia population. That again, it's just another set of eyes on these seniors here in the county. So we also had one where the individual was not looking very good, and the restaurant had reached out to me directly saying, is there any way you could send over an APS social worker to check on this individual, who then ended up that day having to be brought to the hospital. So I think we have a lot of unique stories here, not only from Great Plates, but for many of our nutrition programs that are so vital for our seniors here in San Diego County.
Thank you, Kim. I appreciate that. And I know this program per meal is a little more expensive than like what the food banks are providing, but the delivery service is what is key. And Kim, my understanding is San Diego Food Bank, Feeding San Diego, they have limited ability to actually deliver door to door the food. Most of it is brought to distribution sites. Is that correct?
Yeah, so we have been fortunate in many of our agency programs, not just aging and independent services, to work with both Feeding America and the San Diego Food Bank. One of the challenges always is that delivery is an issue, so many of them offer distribution sites. But for some of our seniors and older adults, leaving the home is not always advisable right now, and also many of them have transportation issues. So one of the things that we are really happy to hear and work with our food banks is that they have what is called a mobile food pantry. And so although they may not be able to do door-to-door delivery, at least we have mobile pantries that go to particular communities for hard-to-reach individuals. We have also partnered with the food bank in other capacities to work at some of our senior housing projects, so that if someone is receiving, whether it's a senior nutrition meals, they also are paired up and may receive a food box from the San Diego Food Bank or from Feeding San Diego.
And Mr. Chairman, and I think that's important, and that's a component of Great Plates, but also what staff brought back, and I think it's a fair plan in the allocation that has been outlined. I'm not going to repeat it. I think everybody knows what that is. If there is a desire to add more money, either to food banks or to the economic stimulus program, as was pointed out before, we've got another 9.2 million as a possibility to allocate to those other needs that we have. So I don't know where my colleagues are on this, but I would hope we could get some support for what staff brought back, supporting the restaurants, supporting our seniors in a couple different ways. And we have an ability with Great Plates too to form our own program and then decrease the number of meals a day, which a lot of seniors have said, 3 meals are too much, but that's what the federal program requires. So I put a motion on the floor to approve the 18.8 million as recommended by staff, and we'll see where it goes.
And there's a motion on the floor by Supervisor Jacob to approve the 18.8 million for the 3 programs. Is there a second to that motion?
I'll second that motion.
Okay, we have a motion and a second. Any further discussion?
Yes, Chair.
Vice Chair Desmond, go ahead.
Thanks, Chair Cox. While I've been critical of the Great Plates program, primarily because of who qualifies, the cost per meal, as compared with the food banks and getting the bang for the buck. I understand that the Great Plates program helps restaurants, and the food is prepared and cooked and delivered and offers contact with the recipients, so the seniors that maybe don't see anybody. It's similar to Meals on Wheels in that effort. And I understand that the federal and state dollars right now are offsetting the greatest part of that program, about 93%, where we're paying only 7% of that program. And I'm going to cross my fingers and hope that the federal and state will continue to fund the program, maybe as long as December. But I would like to ask potentially the maker of the motion that, I feel like it's midnight and I'm at the refrigerator and I'm looking for leftovers. So I got the refrigerator open. So I'm thinking if there's money left over from the Great Plates program that isn't fully spent, because maybe the federal and state government continue to fund it for a longer period of time than we thought, that the balance, if there's a monthly balance, then that go to and stay into the county food banks. So if there's money left over from Great Plates, I would like to, I know you've got Great Plates 2.0 in there as well, but if there's money left over because the federal and state government are continuing that program, I'd like to request the balance go to the food banks. And I'd also like to ask that, I know we're not on the T3 yet, and I'm hoping, if that all that money from the T3, the 5 million, if all the schools don't open up, or all the schools can't use all, don't use all of that money, perhaps by October 27th, which is our second meeting in October, and we only have one meeting in November, December, and that money has to be spent by the end of the year, that money also could possibly go towards a food bank. So I'm looking for leftovers out of the food section here to see if that could go towards, if there is from the either the Great Plates or the T3 portion of this item, that it could go to the food banks.
I don't have a problem with that as long as we do the home delivery part, whether it's the food banks. I mean, my preference would be that any leftovers from Great Plates 1.0 go to 2.0, but if it goes to the food banks and there's home delivery, that serves the same purpose. So I would support that. Maybe we allow staff a little flexibility on that. Would that be acceptable to you, Supervisor?
That would be acceptable, but and I guess if we've got that 9 million left over, if we could put another 5 million of that towards food in the food bank, if there's no money left over, I think that would be a suitable ask as well. So
why don't we talk about that later? Because as Supervisor Gaspar mentioned earlier, there is a huge demand under the economic stimulus program.
But you're absolutely right. And yeah, even with the 9 million, I mean, my district alone, there was 158 million requested for $3 million. And we're all in kind of that same boat. So I guess I would like to make sure that the leftovers are wisely spent. If we can keep the food in the food lane, I think that if there's leftover from the Great Plates, because of the state and federal funding, to put that there, maybe the T3 dollars or the extra dollars could go to the stimulus. But I do think if we can put more money towards the local food banks, we do get, a lot more bang for the buck on the number of meals that are provided, and I would appreciate that. So if you can make that part of the motion to accept, if there's money left over, it goes to the food bank out of the Great Plates.
That would be a part of the motion, and we can take up the testing money separate. That's not a part of my motion. I was just focusing on the 18.8 million. So if we could allow staff some flexibility to make sure any leftovers from the Great Plates 1 would go into food and food delivery, whether it's food bank or, goes into food. Does that work for you?
Well, I guess, yeah, if it goes into 2.0, that's fine. And if there's any money left over after that to go to the food banks and even food delivery within the food banks, it would be fine.
Sounds good. Thank you. No, I think that's a good suggestion.
Okay, so my understanding, the motion that's on the floor by Supervisor Jacobs, seconded by Supervisor Fletcher, is to approve an allocation of 18.8 million of CARES Act funds, which would go to 6.8 million to aging and independent services to expand the Great Plates delivery program, 5 million to implement the Great Plates Delivered 2.0 program, and 3.5 million to go to the provide additional support for restaurants under the business stimulus program. And if there's any residual funding in the Great Plates program, it would be directed to the food banks, and that there be 3.5 million to provide support for the food banks. Is that your understanding of the motion?
I thought Supervisor Desmond said any leftovers could go to Great Plates 2.0 and then the food bank. I thought that was acceptable to him.
Okay, is that acceptable, Mr. Desmond? Vice Chairman Desmond?
So as long as it goes into food and delivery to seniors.
Okay, is that acceptable to the seconder of the motion, Supervisor Fletcher?
That will do.
Okay, there's no further discussion. Would the clerk please call the roll?
Thank you, Chairman Cox.
Aye.
Supervisor Jacob?
Aye.
Supervisor Gaspar?
Aye.
Supervisor Fletcher?
Aye.
Vice Chairman Desmond?
Aye.
Chairman Cox, that motion passes unanimously with all board members being present and voting aye.
Okay, so we've gone from the leftovers to the table scraps, I guess. The last residual component of the money that's left is $5 million, which was being recommended for T3 testing for K through 6 or K through 12? K through 12 schools. What's the pleasure of the board?
Move approval of this item.
Okay, is there a second?
Well, Mr. Chairman, I would second it, to talk about it for discussion, but since a lot of kids are not going back to school, I thought the Supervisor Fletcher's original intention was to make sure that money was provided to test kids going back to school. So if that doesn't happen, and we need to spend this money by the end of the year, my suggestion is maybe come back to the board on the 15th. We have a meeting on the 15th of September, see where we are on that. And then maybe it'll need to be reallocated somewhere else. I don't know. Supervisor, I'm not sure what you have in mind.
I think we've had a number of discussions with a lot of folks that are very interested in how we can proactively try and support our schools. They're going to have tremendous challenges as they try and figure out how they can get kids back safely. They have a big hurdle to meet in terms of testing. And there's also a lot of creative things that I believe we can do from a public health standpoint to support the reopening of schools. Obviously, a lot of it will be geared towards the elementary schools that are a part of the waiver process, and they're going to be in the process of doing that right now. So I think it's fair to come back in September and get an update on the status of the efforts and what we're doing and how much of that we have already expended and how much of it we believe we will expend. And certainly if there's anything left over, then we should look at how we would reallocate it. But I think we need to send a clear message to county staff around testing that we clearly want to support our schools as they go through this effort. And I think the reality that right now they're filling out waiver applications for the elementary side in particular, I think there will be a much greater demand on this $5 million than there is an availability. But I think it is appropriate if we take action today and then we get an update on where we're going in September and we can assess if we think there's going to be any left. We certainly don't want to lose it.
Based on that, I'll second the motion, and that'll be coming back then on September 15th at our board meeting for an update on where we're testing. Okay.
Yes, ma'am.
We have a motion and a second. Is there any further discussion? Okay, if not, we are voting on a motion by Supervisor Fletcher, seconded by Supervisor Jacob to go ahead and approve a $5 million allocation of CARES Act funds for testing, tracing, and treatment strategies for K through 12 schools. Would the clerk please call the roll?
Thank you. Chairman Cox?
Aye.
Supervisor Jacob?
Aye.
Supervisor Gaspar?
Aye.
Supervisor Fletcher?
Aye.
Vice Chairman Desmond?
Aye.
Chairman Cox, that motion passes unanimously with all board members being present and voting aye.
And I think maybe just to make sure that we tie all this with a proper bow, we've got a lot of establishing of appropriations and follow-up actions. I would move the balance of the staff recommendations on item number 3.
Second.
Can I just, one clarification, Chairman, I'd like to ask of staff. I'm assuming on the restaurant category, we have a number of applicants from our districts that represent breweries, wineries, caterers. I assume they can all fall under that restaurant category and be eligible for those CARES Act funds.
That is correct, Supervisor.
Thank you.
Okay, any further discussion? All those in favor of the motion, or excuse me, would the clerk please call the roll?
Thank you. Chairman Cox?
Aye.
Supervisor Jacob?
Aye.
Supervisor Gaspar?
Aye.
Supervisor Fletcher?
Fletcher, aye.
Vice Chairman Desmond?
Aye.
Chairman Cox, that motion passes unanimously with all board members being present and voting aye.
Okay, what I would propose at this point is we do have a number of adjournments in memory. I'd like to go ahead and deal with those right now if we can. And then adjourn into closed session to deal with the 6 action items, 2 evaluations. I would propose we hold off until tomorrow and deal with those after the land use hearing. If there is no objection to that, we'll start off with Vice Chairman Jim Desmond to deal with his adjournments in memory.
Okay, thank you very much, Supervisor Cox. I'd like to adjourn today's meeting in memory of Dave Kulchin. Dave passed away on July 12th at age 91. Dave is committed to his loving wife and his family and serving his community. He and his wife Ann were married for 66 years as residents of Carlsbad since 1978. And many of you know Ann because she served on this Carlsbad City Council for 32 years. Dave served as a director of human resources for Hughes Aircraft Company in Carlsbad and later becoming a human resources consultant with extensive experience in large and small organizations. Dave is also known for his volunteerism and diligently served on several boards and nonprofit organizations. He was elected to serve on the Leucadia Water District Board or Wastewater Board for the last 24 years. He's a lifetime honorary board member for the Boys and Girls Club of Carlsbad. He served on the Magdalena Ecke Family YMCA in Encinitas. He served on the Hospice of North Coast, the Scripps Memorial Hospital, Encinitas Community Advisory Board, and Carlsbad High Noon Rotary Club. Dave successfully led a campaign raising $1.2 million to build the branch of the Boys and Girls Club in Bressie Ranch in Carlsbad. As chair of the Scripps Hospital Advisory Board, he helped raise money to build a critical care wing in Encinitas. In 2013, Dave was named Carlsbad Citizen of the Year. Dave's caring nature, generosity, and legacy will live on through his tremendous contributions to our community and for the love of his family. I have another second adjournment. This one is an adjournment in memory of 8 U.S. Marines and 1 Navy sailor. Sadly, 8 U.S. Marines and 1 Navy sailor were tragically killed in a training accident off the coast of Southern California on Thursday, July 30th. All the service member victims were between the ages of 19 and 23 years old. The accident occurred inside an amphibious assault vehicle during a 15th Marine Expeditionary Unit in Macon Island Amphibious Ready Group routine training exercise near San Clemente Island. With a heavy heart, we honor and thank and salute their service and their deep commitment to defend our great nation. The victims included 19-year-old PFC Brian Battaglia of Corona, California, 21-year-old Lance Corporal Marco Barranco of Montebello, California, 19-year-old PFC Evan A. Bath of Oak Creek, Wisconsin, 22-year-old U.S. Navy Hospital Corpsman Christopher Gnem of Stockton, California, a 20-year-old PFC Jack Ryan Ostrovsky of Bend, Oregon, 20-year-old Lance Corporal Guillermo Perez, 20, of New Braunfels, Texas, 23-year-old Corporal Wesley A. Rod of Harris, Texas, 19-year-old Rifleman Lance Corporal Chase Sweetwood, Portland, Oregon, and 21-year-old Corporal Cesar Villanueva of Riverside, California. Please keep all these young men and their fellow Marines in your thoughts and prayers, and our deepest condolences go out to their families and their loved ones. Thank you.
Thank you, Supervisor. We'll now proceed to our Supervisor Diane Jacob, who has 2 adjournments in memory.
Thank you, Mr. Chairman. The first adjournment I have is in memory of Rosemary Putnam. She was one of the region's great champions of public libraries. Rosemary was born in Illinois in 1921, and during the Depression, the family moved to San Diego. In 1942, she married her husband of 53 years, Rear Admiral Ira Dwight Putnam, and raised 3 daughters in their historic Lemon Grove home. Rosemary was a founding member of the Friends of the Lemon Grove Library, where she served for 3 decades. She has sorted thousands of books for successful fundraising efforts and was instrumental in establishing the Friends Bookstore. Rosemary was an active community member serving several organizations, including the Lemon Grove Chamber of Commerce, Lemon Grove Historical Society, Seroptimus International of Lemon Grove, and the Girl Scouts. The Rosemary Putnam Community Room in the Lemon Grove Library honors her work. Rosemary was also honored in 1998 as Lemon Grove Citizen of the Year, and the County Board of Supervisors recognized her in 2001 as Volunteer of the Year. And in 2004, she was recognized by the state legislature as Literacy Volunteer of the Year. She had superb amount of energy, wisdom, and kindness that have benefited so many people and enhanced the quality of life in the community. And she was instrumental in bringing the new library on the school site in Lemon Grove. Rosemary is survived by 3 daughters, Christine, Patricia, and Susie, 7 grandchildren, and 14 great-grandchildren. I want to take a moment to thank Rosemary and her family for her service and her many, many contributions to the community. What a wonderful woman, and she certainly will be missed. My final adjournment will be in memory of Nora Leigh Gastineau, who is a Lakeside community member. Nora was born in 1956, and she passed away from a short battle with breast cancer. She never quit during her illness. She was a very determined, strong, and resilient woman. Nora is survived by her husband of 46 years, Jim, her 2 sons, Brian and Jim III, and 8 grandchildren. She too will be deeply missed by her family and her many friends. Thank you, Mr. Chairman.
Thank you, Supervisor. We'll move on now to Supervisor Kristen Gaspar, who has an adjournment in memory.
Thank you, Chairman. I would like to adjourn today's meeting in memory of Nancy Halm. Nancy was an educator, a restaurateur, and an active member of San Diego's Chinese community. She passed away at the age of 77 from complications of Alzheimer's. Nancy was born in China, where she studied to be a teacher and met her husband, Jackson. The two moved to San Diego in the early 60s and started a new life. The Halms used their experience in the restaurant business to open the Land of China restaurant in Chula Vista. It became a local favorite, encouraging the couple to open a second location in Seaport Village. Nancy and her husband had 3 children, Dan, Ray, and Mimi. As a former teacher, education was a priority in her home, paving the way for academic opportunities for her children that she never had. Living in San Diego, Nancy became very involved in the Chinese community. She was one of the founders of the Lin Hua Music Center and an active member of the Ying An Merchant Business Association. She loved hosting at their home, inviting family and friends to feast on her delicious food. With her friends, she loved a good game of mahjong. On the evening of July 7th, Nancy was fortunate to be surrounded by her 3 children and their spouses, as well as her 6 grandchildren, as they said their final goodbyes. Nancy will be dearly missed.
Thank you, Supervisor. And Supervisor Fletcher has an adjournment.
Thank you, Mr. Chair. Last week, one of our own lost an important person in their life, a family member, Tiffany Frost, who's a vital and cherished member of the District 4 team, lost her father, Mike Gillespie. In addition to her dad, her mother's husband, who was a grandfather and a brother. Mike Gillespie lived a long life to 80 years old. And today I would like to adjourn today's Board of Supervisors meeting in his honor. Mike loved his family, and he also loved the game of baseball. He is an iconic figure in the baseball world who was known for trusting his gut, for calling plays that others would have never been brave enough to attempt, for having a firm approach and attitude with his players, which underlined a deep commitment and appreciation for them as individuals and for their success. It also secured his role as one of college baseball's greatest coaches of all time. He played his college baseball at the University of Southern California, where he played and won the 1961 College World Series as a member of the team. And after college, he coached some high school teams before turning College of the Canyons into a powerhouse program. With him creating the program and leading the way, they won 3 state titles and 11 conference championships. It was a junior college program like none other. He went on to manage the University of Southern California as their head coach, where he helped them win and was the coach when they won the 1998 College World Series, one of only 2 people to ever play in as a player and as a coach winning that. He had a truly memorable play of stealing home in the middle of a College World Series with the stakes high that is talked about to this day. Enshrined in the USC Hall of Fame, Mike spent nearly 50 years as a baseball coach. After he left USC, he went on to coach at UC Irvine, again, creating that program and taking them to the College World Series as well. Many of his players have advanced to careers in the major leagues, including the current Yankees manager and former Major League All-Star Aaron Boone and others. And Mike will be deeply missed, both by the players who played in his coaching career with more than 1,500 wins, by his family who loved him dearly, and by a community who appreciates all that he meant and that he represented. He's survived by his wife, Barbara, his children, Kelly, Mitch, Matt, and Tiffany, his grandchildren, Cade, Cole, Samantha, and Cooper, and his brother, Jerry. And so I'd like to adjourn today's meeting in honor of Mike Gillespie. Thank you.
Thank you, Supervisor. I have 2 adjournments in memory today that I would like to share with you at this time. First is in honor of Dolores Robledo, who is one of the founders of an iconic Mexican restaurant chain in San Diego. She passed away on July 14th at the age of 90. Mrs. Robledo grew up in a tiny ranching village in Mexico and immigrated to California in 1957 with her husband, Roberto, and their children. The husband and wife worked at various jobs, and in 1964, they opened a tortilleria at the U.S.-Mexico border in San Isidro. They would open 5 restaurants over the next 5 years, keeping their original names. But in 1969, they purchased a burger place in San Diego, and they called it Roberto's Taco Shop. Well, the rest is history. It became popular for its rolled taco plates, and they later introduced the carne asada burrito to San Diego. Roberto's would go on to become a local institution that would inspire dozens of similar restaurants throughout the region that use some form of the name Berto's name. Mrs. Robledo is survived by 10 children, 39 grandchildren, and dozens of great and great-great-grandchildren. Through talent and hard work, Dolores Robledo achieved the American dream and became a San Diego success story, and she will be greatly missed. Second adjournment that I have today is to honor Frank Scott, a former mayor and council member in Chula Vista who worked tirelessly to improve the city he loved. He passed away on July 6th at the age of 86. Born in San Diego, Mr. Scott served in the Navy during the Korean War. After his service ended, he earned a business degree from what is now known as San Diego State, what was then known, I should say, as San Diego State College. He became involved in a local civic group and in 1968 was elected to the Chula Vista City Council. He was then reelected in 1972 and ultimately he served 4 terms as a council member and a few months as the interim mayor of Chula Vista in 1977. Excuse me. All told, Frank Scott served more than 18 years on the Chula Vista City Council, making him the longest serving member of the Chula Vista City Council. He resigned in 1986, citing the demands of his job as a senior financial consultant with Merrill Lynch, Pierce, Finner, and Smith, Inc. I was honored to succeed Frank Scott on his completion of his 2nd term on the Chula Vista City Council. During his time on the city council, Mr. Scott's biggest priority was working to develop the city's bayfront. He was an advocate of planned growth, and I have to tell you, it's a real shame that he will not be around for the scheduled groundbreaking next year of the Bayfront Project Hotel and Convention Center in Chula Vista. But his role in that project won't be forgotten. Frank is survived by his wife of 67 years, Colleen, and his children, Karen, Suzanne, and Tom, and his sister, Jeannie Jensen. I learned a lot from Frank Scott, and I know that the city of Chula Vista is a better place because of him and the service that he provided to that city. With that, we will adjourn into closed session. If there are any reportable items out of closed session, it will be announced at the beginning of tomorrow's land use hearing. And if there's nothing else to come before us today, we will stand adjourned to August 4th at 9 a.m. for the land use hearing. Meeting is adjourned.